zurückzukehren. Für mich ist es ja die letzte Regierungsbefragung. Insofern will ich die Gelegenheit auch nutzen, Danke zu sagen für die Zusammenarbeit, aber auch noch mal sagen, dass das, was wir da gehört haben, glaube ich, auch eine Verpflichtung für uns alle bleiben wird.
Vielen Dank. Das Wort zum zweiten einleitenden Bericht hat die Bundesministerin für wirtschaftliche Zusammenarbeit und Entwicklung, Frau Svenja Schulze. Bitte schön.
Frau Präsidentin, herzlichen Dank. Wir haben hier eine intensive Debatte um die Regierungserklärung des Bundeskanzlers gerade hinter uns. Und die grausame Gewalttat in Aschaffenburg ist wirklich furchtbar. Es ist furchtbar, wenn ein psychisch kranker Mensch ein Kind tötet, Jannis, und ein weiteres verletzt, und wenn ein Mann bei dem Versuch stirbt, die Kinder zu retten. Das muss aufgeklärt werden, und es muss alles getan werden, dass solche Taten in der Zukunft verhindert werden. Ich finde es aber auch erschreckend, wie die Debatte insgesamt geführt wird. Wenn hier diese furchtbare Tat genutzt wird, um pauschal allen Menschen, die zu uns fliehen mussten, das Recht auf Asyl abzuerkennen, wenn es Parteien grundsätzlich das Grundrecht auf Asyl infrage stellen, dann ist das wirklich geschichtsvergessen. Und ich bin sehr froh, dass unser Bundeskanzler auch noch mal klargestellt hat, dass das Recht auf Asyl ein Teil unserer Werteordnung ist und ein Teil unserer historischen Erfahrung. Liebe Kolleginnen und Kollegen, ich weiß als Entwicklungsministerin, wie furchtbar die Situation ist für die Länder, die die meisten Flüchtlinge aufnehmen müssen. Das sind die Nachbarländer. Ich weiß aber auch, welche Herausforderung das für uns ist. Ich bin aber fest davon überzeugt, dass demokratische Lösungen da die richtige Antwort sind. Und wir sind es doch in dieser Regierung, die endlich dafür gesorgt haben, dass es wieder ein gemeinsames europäisches Asylsystem gibt. Nancy Faeser ist die Ministerin, die den Stillstand, der dort seit Jahren geherrscht hat, endlich beendet hat. Wir sind es, die die entwicklungspolitische Arbeit vorangetrieben haben, sodass endlich die Ursachen der Flucht bekämpft werden. Und das ist etwas, was mir hier in der Debatte fehlt. Die Menschen fliehen, weil sie aus Kriegen, weil sie aus furchtbaren Situationen vor Ort fliehen. Und deswegen braucht es eine starke, mir hier in der Debatte fehlt. Die Menschen fliehen, weil sie aus Kriegen, weil sie aus furchtbaren Situationen vor Ort fliehen. Und deswegen braucht es eine starke Entwicklungspolitik. Und es braucht mehr internationales Engagement und nicht weniger, wie ja hier einige konservative Politikerinnen und Politiker im Haus gefordert haben. Und ich will hier aber auch noch mal sagen, dass ich es einen wirklichen Tabubruch finde, wenn hier im Parlament darauf gesetzt wird, dass man mit anerkannt Rechtsradikalen gemeinsam hier Mehrheiten organisiert. Ich will das deutlich noch mal sagen, dass so eine Gewalttat, die darf nicht zu Enthemmung, die darf nicht zu Radikalisierung führen. Ich will da ausdrücklich noch mal hervorheben, was uns die beiden großen Kirchen, was evangelische und katholische Kirche uns geschrieben haben. Das muss uns insgesamt nachdenklich stimmen. Es darf keine Zusammenarbeit mit gesichert Rechtsextremen hier geben. Und ich sage das ganz bewusst als Entwicklungsministerin. Ich sehe in so vielen Ländern der Welt, wie es den Feinden der Demokratie gelingt, Staaten zu verändern. Und deswegen appelliere ich von hier auch noch mal an alle Demokratinnen und Demokraten, unsere Demokratie zu schützen und den Feinden der Demokratie hier keine Plattformen zu bieten. Danke sehr.
So, Sie benennen jetzt bitte, an wen Sie Ihre jeweiligen Fragen stellen wollen. Alfred Stegemann ist für die Union der erste Fragesteller. Bitte schön.
Vielen Dank. Wir haben dort viele Stände besucht. Auch Friedrich Merz war bei vielen Ständen zugegen. Und immer wieder kam das Thema Mindestlohn 15 € auf. Und meine Frage an Sie als Fachpolitiker, wie schätzen Sie ein, welchen Einfluss hat ein Mindestlohn von 15 € insbesondere im Obst- und Gemüsebau, wo wir ja 70% der Gesamtkosten im Lohnkostenbereich haben. Was denken Sie, was macht das mit der Wettbewerbsfähigkeit unserer Obst- und Gemüsebauern, aber was macht das eben auch mit der Versorgungssicherheit in unserem Land?
beim Obst- und beim Gemüseanbau in Deutschland weit von der Selbstversorgung entfernt. Das ist auch nicht erreichbar, aber wir sollten aufpassen, dass wir nicht weiter runtergehen. Und da spielen viele Faktoren eine Rolle, dass bei uns die Kosten höher sind. Da trägt der Mindestlohn dazu bei, viele andere Faktoren sicherlich auch. Ich glaube, dass wir aus übergeordneten Gründen uns ja zu Recht hier verständigt haben, dass wir einen Mindestlohn brauchen, dass eine Lohnuntergrenze Sinn macht, weil wir alle gemeinsam dafür sorgen wollen, dass Armut, Not bekämpft wird, dass Menschen von ihrer Arbeit menschenwürdig leben können. Hier gibt es eine Baustelle, die ist, wenn wir den dass Armut, Not bekämpft wird, dass Menschen von ihrer Arbeit menschenwürdig leben können. Hier gibt es eine Baustelle, die ist, wenn wir den Mindestlohn jetzt quasi auf Zuruf erhöhen und nicht die Kommission, die wir ja eingesetzt haben, nämlich eine Mindestlohnkommission, die ja genau dafür da ist, ihre Arbeit machen lassen, dann trägt es natürlich dazu bei, dass die Wettbewerbsbedingungen für Obst- und Gemüsebau nicht besser werden.
Haben Sie eine Nachfrage, Herr
Ja,
Stiefelmann? Bitte sehr.
also das klingt jetzt erstmal interessant, weil ich habe doch vernommen, dass sowohl die Grünen als auch die SPD für einen politischen Mindestlohn von 15 € sind. Ich war damals selbst im Ausschuss für Arbeit und Soziales dabei, bei der Konstruktion, dass wir eben eine Mindestlohnkommission haben und dass dort Arbeitgeber, Arbeitnehmer, aber auch die Wissenschaft mit am Tisch ist, damit eben kein politisches Dumping sozusagen losläuft. Aber wie bringen Sie das jetzt mit Ihrer getätigten Aussage zusammen?
Ganz so, wie ich es im Eingangsstatement gesagt habe. Ich schaue mir immer erst mal die Probleme an, nicht die Parteiprogramme. Und ich bin Landwirtschaftsminister des Landes. Sie haben den Landwirtschaftsminister gefragt und ich antworte auf die Fragen wahrheitsgemäß. Und es ist nun mal so, dass im Obst- und Gemüsebau das ein Faktor, nicht der einzige Faktor ist. Sie wissen, wir haben es gerade auch mit Krankheiten zu tun, mit anderen Dingen, aber es ist eben auch ein Faktor. Gleichzeitig sind wir natürlich auch im Wettbewerb. Wir haben ein Interesse daran, dass wir Arbeitnehmer, Saisonarbeitskräfte bekommen. Auch da gab es Skandale in der Vergangenheit. Wir müssen also auch dafür sorgen, dass wir attraktiv sind. Das ist ein Spannungsverhältnis. Ich will da gar nicht drum herum reden.
Ja, wunderbar. Vielen Dank.
Die zweite Frage kommt von Sonja Abdi.
Ja, vielen Dank. Ich möchte meine Frage gerne an Bundesministerin Svenja Schulze richten. Sehr geehrte Frau Ministerin, Sie waren erst kürzlich in Syrien, um sich vor Ort ein Bild zu machen, wie Deutschland zu einem friedlichen und stabilen Syrien nach Sturz des Assad-Regimes beitragen kann. Ich möchte Sie gerne fragen, wie Sie sich vorstellen, wie die deutsche Bundesregierung Syrien beim Wiederaufbau des Landes unterstützen kann, insbesondere auch im Hinblick auf die große Diaspora hier in Deutschland unter Hinzuziehung eben dieser wichtigen Expertise und Ressource. Danke.
Frau Abgeordnete, herzlichen Dank für die Frage. Die Situation in Syrien ist wirklich gerade sehr schwierig. Es ist der syrischen Bevölkerung gelungen, nach vielen, vielen Jahren eine Diktatur zu beenden. Das ist erstmal eine Leistung, vor der ich einen enormen Respekt habe. Aber wie sich das Land jetzt weiterentwickelt, ob es wirklich gelingt, dass all die unterschiedlichen Religionsgruppen, die verschiedenen Gruppen, die im Land sind, jetzt an der neuen Regierung beteiligt werden, das ist noch nicht ganz klar abzusehen. Wir haben erste Gespräche geführt, die Außenministerin, ich habe Gespräche geführt. Und deswegen werden wir jetzt beginnen, erstmal auf der lokalen und regionalen Ebene Partnerschaften aufzubauen. Wir haben ja sehr viele Syrerinnen und Syrer hier in Deutschland, die zum Beispiel im Gesundheitsbereich arbeiten, die gerne helfen wollen, das Land wieder aufzubauen. Deswegen sind ganz konkrete Krankenhauspartnerschaften das Erste, was wir jetzt in Angriff nehmen wollen, das Bildungssystem helfen wieder aufzubauen, zusammen mit den Organisationen der Vereinten Nationen und dann Schritt für Schritt gucken, was vielleicht noch mehr möglich ist. Es wäre gut, wenn Deutschland diesem Land, diesem zentralen Land im Nahen Osten beim Wiederaufbau hilft.
Haben Sie eine Nachfrage? Das ist nicht der Fall. Ich weise Sie alle darauf hin, dass in einer Minute die Zeit für die namentliche Abstimmung vorbei ist. Diese Minute nutzen wir dafür, dass Till Mansmann seine Frage stellen kann.
Meine Frage geht an Bundesministerin Schulze. Frau Ministerin Schulze, anders als die humanitäre Hilfe des Auswärtigen Amtes ist unsere Entwicklungszusammenarbeit immer an Bedingungen geknüpft, denn es ist ja eine Zusammenarbeit und sie erfordert ein Mindestmaß an Kooperation. Die Wahrung deutscher Interessen darf dabei keine Ressortangelegenheit einzelner Häuser bleiben. Stattdessen ist ein strategisch vernetzter Ansatz nötig, der neben Außenpolitik auch die Entwicklungszusammenarbeit einschließt. Vor diesem Hintergrund meine Frage. Syrien ist gerade schon angesprochen worden. Planen Sie im aktuellen Kontext auch gegenüber den aktuellen de facto Machthabern in Syrien darauf hinzuwirken, dass die Aufnahme ausreisepflichtiger Staatsbürger zur Bedingung für Entwicklungszusammenarbeit wird, sollten die dafür übrigen Voraussetzungen gegeben sein?
Herr Abgeordneter, wir arbeiten in vielen Kontexten auf der Welt nicht unmittelbar mit den Regierungen zusammen, weil es einfach schwierige Regierungen sind. Ich habe ja heute hier auch die Forderung gehört, wir sollten in Afghanistan mit der Regierung verhandeln. Auch weder in Syrien noch in Afghanistan arbeiten wir mit der Regierung, sondern wir arbeiten mit lokalen Organisationen, wir arbeiten mit regionalen Organisationen, die dort eben dann die entwicklungspolitische Arbeit voranbringen, ein Gesundheitssystem aufbauen, helfen, Schulen aufzubauen. Und deswegen ist es sehr schwierig, mit lokalen NGOs Regierungsverhandlungen zu führen. Ich weiß nicht, wie das konkret gelingen soll. Ich weiß aber auch nicht, wie man mit Regierungen, die noch nicht anerkannt sind, die eigentlich keinen legalen Status haben, wie man mit denen verhandeln soll. Das geht, glaube ich, nicht in solchen Kontexten. Ich halte den Weg der Migrationsabkommen, die diese Regierung ja angefangen hat, mit einem speziellen Beauftragten, mit Herrn Stamp, das für einen sehr erfolgreichen Weg, die Entwicklungszusammenarbeit an sowas zu binden, ist noch bisher nirgendwo auf der Welt erfolgreich gewesen und ist, glaube ich, nicht der richtige Weg.
Haben Sie eine Nachfrage?
Ja,
Jetzt sofort tun. Bitte schön.
Ja, Frau Ministerin Schulze, ich hatte ja gefragt, wenn dann die entsprechenden Voraussetzungen vorliegen. Ich nehme ein anderes Beispiel. Das ist Gambia. Wir haben 9.000 ausreisepflichtige Bürger aus Gambia hier in Deutschland. Schließen Sie aus, dass wir mit Gambia im Entwicklungszusammenarbeitskontext über diesen ausreisepflichtige Bürger aus Gambia hier in Deutschland, schließen Sie aus, dass wir mit Gambia im Entwicklungszusammenarbeitskontext über diese Frage sprechen? Oder halten Sie es nicht auch für sinnvoll, dass in diesem Zusammenhang mit der gambischen Regierung über ausreisepflichtige Bürger gesprochen wird?
Herr Abgeordneter, ich halte es für absolut sinnvoll, dass mit den Regierungen darüber gesprochen wird, dass ausreisepflichtige Menschen hier aus Deutschland zurückgenommen werden. Was ich nicht richtig finde, ist die entwicklungspolitische Arbeit daran zu binden und zu sagen, wenn ihr euch nicht anständig benehmt, dann unterstützen wir die Frauen bei euch nicht mehr. Ich glaube, das würde die Taliban nicht sonderlich beeindrucken. Also positive Anreize zu geben, wie wir das mit den Migrationsabkommen machen, positive Anreize zu geben, zu sagen, wir verstärken zum Beispiel die Zusammenarbeit im Bereich der beruflichen Ausbildung und dafür werden dann eben in dem Abkommen auch vereinbart, dass Menschen zurückgenommen werden, die nicht in unserem Land bleiben können. Das finde ich genau den richtigen Ansatz.
Vielen Dank. Ich sehe kein Mitglied des Hauses, das noch nicht an der namentlichen Abstimmung teilnehmen konnte. Mithin schließe ich die Abstimmung und bitte die Schriftführerinnen und Schriftführer, mit der Auszählung zu beginnen. Wir müssen jetzt einen ganz kleinen Moment warten, dass ich die nächste Abstimmung eröffnen kann, damit die
alle ausgetauscht.
Herzlichen Dank für die Schnelligkeit draußen in der Lobby an diejenigen, die als Assistentinnen und Assistenten dafür gesorgt haben, dass die Urnen so schnell ausgetauscht sind. Damit können wir die namentliche Abstimmung Nummer 2 beginnen, und zwar über den Entschließungsantrag der Fraktion der CDU/CSU auf Drucksache 14699. Sie haben zur Abgabe Ihrer Stimme nach der Eröffnung der Abstimmung 20 Minuten Zeit. Die Schriftführerinnen und Schriftführer haben die vorgesehenen Plätze eingenommen. Ich eröffne hiermit die zweite namentliche Abstimmung, und zwar über den Entschließungsantrag der Fraktion der CDU/CSU auf Drucksache 14.699. Wir beenden diese Abstimmung um 17:25 Uhr. 17:25 Uhr beenden wir diese Abstimmung. Vielen Dank. Und ich weise darauf hin, dass wir noch in der ersten Runde der Befragung sind. Und das heißt, dass ich noch keine Meldungen aus der Mitte des Hauses annehme, weil ich hier einige sehe, wahrscheinlich nicht hier das PGF. So, damit hat Katrin Henneberger das Wort für ihre Frage.
An Ministerin Schulze. Leider ist auch der Kern einer faschistischen und antidemokratischen Politik auch die finanziellen Mittel für Entwicklungszusammenarbeit und humanitäre Hilfe in Frage zu stellen.
Ich habe das Gefühl, dass man das Mikro quasi nicht hören kann. Deswegen bitte ich um zwei Dinge. Erstens, dass es insgesamt leiser ist im Raum. Und zweitens vielleicht noch ein bisschen dichter ran und vielleicht noch mal anfangen. Dankeschön.
Meine Frage geht an Ministerin Schulze. Leider ist es auch so, dass Kern einer faschistischen, antidemokratischen Politik es ist, die finanziellen Mittel für humanitäre Hilfe als auch für Entwicklungszusammenarbeit in Frage zu stellen, sie sogar zu bekämpfen. Und mit dem Amtsantritt von Donald Trump wurde direkt erlassen ein Austritt aus der Weltgesundheitsorganisation, ein Austritt aus dem Übereinkommen von Paris. Und es wurde die Entwicklungsfinanzierung Trump wurde direkt erlassen, ein Austritt aus der Weltgesundheitsorganisation, ein Austritt aus dem Übereinkommen von Paris und es wurde die Entwicklungsfinanzierung vorerst gestoppt. Welche Auswirkungen wird dies global bedeuten? Welche Maßnahmen wird die Bundesregierung deshalb treffen? Und welche Verantwortung haben wir im Parlament, gegen diese faschistische Politik, gegen humanitäre Hilfe und Entwicklungszusammenarbeit zu stehen?
Frau Abgeordnete, herzlichen Dank für die Frage. Ja, die USA haben bedauerlicherweise entschieden, aus dem Klimaabkommen auszusteigen, die Weltgesundheitsorganisation zu verlassen. Und das wird massive Auswirkungen auf die Welt haben. Und es kann kein Land der Welt alleine auffangen, was aus den USA jetzt alles fehlen wird. Aber wir sind diesmal besser darauf vorbereitet. Und es ist vollkommen klar, dass die Antwort darauf lauten muss, dass wir noch besser zusammenarbeiten müssen, dass wir mehr gemeinsame Projekte in der Welt voranbringen müssen, um das eben aufzufangen. Gerade der Klimaschutz braucht jetzt dann eben mehr Zusammenarbeit mit den lokalen und regionalen Ebenen in den USA, die ja auch im Klimaschutz aktiv sind. Wir werden auch noch mehr tun müssen, um private Investoren mit dafür zu gewinnen, in den Klimaschutz zu investieren. Aber es wird eine Lücke reißen, das ist vollkommen klar.
Haben Sie eine Nachfrage, Frau Henneberger? Bitte schön.
Beispiel der eskalierenden Gewalt auch in der Demokratischen Republik Kongo. Welche Rolle wird Entwicklungszusammenarbeit und humanitäre Hilfe auch hier spielen, um eine Befriedung als auch zukünftig eine Stärkung der Sicherheit zu gewährleisten?
Frau Abgeordnete, die Situation im Ostkongo ist wirklich bedrückend. Das ist eine Region, sowohl im Kongo als auch in Ruanda, die nach Jahren des Krieges immer noch mit enormer Armut kämpft. Und dass es ausgerechnet dort jetzt wieder zu eskalierender Gewalt kommt, ist etwas, was uns alle beunruhigen muss, weil das Hunderttausende von Menschen zwingt, zu fliehen aus dieser Region. Die werden dort nicht bleiben können. Und deswegen ist es absolut klar, dass die Gewalt dort enden muss, dass wir endlich auch in dieser Region die Anerkennung der Grenzen haben. Wir setzen uns weltweit dafür ein, dass Grenzen eben nicht verletzt werden. Und das tun wir auch an der Grenze zwischen Ruanda und dem Kongo.
Die nächste Hauptfrage kommt von Stefan Protschka.
Frau Präsidentin, danke. Herr Minister Özdemir, Sie haben erwähnt, wie wichtig das Landwirtschaft ist in Ihrem Eingangsstatement, vor allem Ernährungssicherung und vor allem in Krisenzeiten, jetzt mit dem Angriffskrieg Russlands auf die Ukraine. Sie haben auch zu Ihrer Amtseinführung, ich zitiere, gesagt, Sie sehen sich als oberster Anwalt der Landwirte. Das war Ihr Eingangsstatement. Doch Ihre Bilanz in der Amtszeit ist eher verheerend. Wir haben in Ihrer Amtszeit mindestens 3.700 Höfe, die schließen mussten. Und wir haben im letzten Jahr einen Umsatzeinbruch bei der Landwirtschaft von 30%. Und zu den massiv eingebrochenen landwirtschaftlichen Einkommen im vergangenen Jahr warten wir leider immer noch vergeblich auf eine Stellungnahme aus Ihrem Haus. Bis wann können wir mit der Stellungnahme denn rechnen? Dankeschön.
Frau Präsidentin, Herr Abgeordneter! Also zum einen die Bilanz. Wir haben sicherlich nicht alles, was die Vorhaben angeht, durchgesetzt. Aber ich habe mir mal die Gesamtliste angeschaut. Wenn man mal die Legislaturperiode, die verkürzt ist, betrachtet, ist die Gesamtvorhabenliste, muss sich nicht verstecken im Verhältnis zur Legislaturperiode davor. Das ist mal die quantitative Frage. Und zur qualitativen Frage. Wir haben beispielsweise mit dem Umbau der Tierhaltung, wenn Sie sich mit Landwirtschaft beschäftigen, wissen Sie, da ist die Not gerade mit am größten, weil viele Tierhalter umgehen. Endlich angefangen vom Herkunftskennzeichen, Ausweitung bis zur Frage der Finanzierung bei den Schweinehaltern bleibt sicherlich noch einiges übrig. Entbürokratisierung, endlich den Schalter umgelegt. Mit Blick auf die Uhr, weil es schon gelb ist, will ich mal sagen, ich habe mir mal die Zahlen zur Einkommenssituation angeschaut. Wenn Sie das mal betrachten, waren die letzten Jahre.
Herr Brotschka, Sie haben eine Nachfrage, bitte.
Danke, Frau Präsidentin, Herr Minister. Ja, man kann alle Zahlen schönreden, aber ich glaube, ein Umsatzeinbruch oder Verdiensteinbruch von 30% ist relativ hoch. Wir haben im Dezember schon die Staatssekretärin im Ausschuss darauf angesprochen und sie hat uns versichert, dass die Zahlen baldmöglichst veröffentlicht werden. Jetzt stehen natürlich in 3 Wochen Wahlen ins Haus. Werden Sie die Zahlen noch vor den Wahlen veröffentlichen oder versichert, dass die Zahlen baldmöglichst veröffentlicht werden? Jetzt stehen natürlich in 3 Wochen Wahlen ins Haus. Werden Sie die Zahlen noch vor den Wahlen veröffentlichen oder wollen Sie Ihren Wahlkampf nicht gefährden und die Zahlen dann erst nach dem Wahlkampf veröffentlichen, dass es katastrophal ist, was zurzeit in der Landwirtschaft los ist? Dankeschön.
Also mein Haus arbeitet so schnell wie möglich. Allerdings haben Sie sicherlich auch Verständnis dafür, dass bei uns gerade die höchste Priorität die Maul- und Klauenseuche hat. Und wenn Ihnen die Landwirtschaft am Herzen ist, so wie es, denke ich, allen hier ist, dann wissen Sie, das ist gerade das, wo der Kittel brennt und wo wir alles dafür tun müssen. Ansonsten arbeiten wir alles ab. Und was immer vor der Wahl geht, werden wir machen. Aber Sie geben mir die Gelegenheit, mit Blick auf die Uhr will ich noch mal sagen, der Strukturwandel der Landwirtschaft hat sich Gott sei Dank endlich verlangsamt. Es bleibt noch genug übrig für die künftige Hausführung. Aber wir werden das nur erreichen, wenn wir nicht mit 51% gegen 49% arbeiten, sondern Planungssicherheit gibt es nur, wenn alle hier zusammenarbeiten.
Vielen Dank. Wir kommen zum zweiten Abschnitt, wo wir dann auch die Fragen aus der Mitte des Hauses entgegennehmen. Die erste in diesem Abschnitt kommt von Dr. Wolfgang Stefinger.
Vielen Dank, Frau Präsidentin. Meine Frage geht an Frau Bundesministerin Schulze. Ist das Personal im Entwicklungsministerium um 15% angewachsen, während gleichzeitig der Haushalt um 25% gesunken ist. Ich möchte Sie daher fragen, für was braucht immer weniger Hilfe, immer mehr Verwaltung?
Herr Abgeordneter, herzlichen Dank für die Frage. Was wir verändert haben in der laufenden Legislaturperiode ist, dass wir uns in den internationalen Gremien viel stärker eingemischt haben. Herzlichen Dank für die Frage. Was wir verändert haben in der laufenden Legislaturperiode ist, dass wir uns in den internationalen Gremien viel stärker eingemischt haben. Wir wollen die großen internationalen Geldflüsse mit beeinflussen, zum Beispiel bei der Weltbank. Und das geht nur, wenn man wirklich dann da auch präsent ist, wenn man mit Personal in die Diskussionen dann auch hineingeht. Wenn wir wirklich unsere Rolle international wahrnehmen wollen, dann müssen wir auch mit dem entsprechenden Personal dort sein. Und gerade wenn man weniger Geld hat, muss man ganz besonders darauf achten, dass man einen möglichst großen Hebel ansetzt. Das habe ich in dieser Legislaturperiode an vielen Stellen gezeigt, dass ich das geschafft habe.
Eine Nachfrage haben Sie, bitte schön.
Vielen Dank, Frau Ministerin. Gerade mit dieser Erklärung, die Sie gerade gegeben haben, können Sie mir dann bestimmt erklären, wie es sein kann, dass ein SPD-Mitglied ohne jegliche entwicklungspolitische Vorkenntnis von Ihnen ins Haus geholt wurde, mit einem eigentlich befristeten Vertrag. Dieser Vertrag jetzt unbefristet sein soll, plötzlich am Betriebsrat vorbei, und dieser für Ihre persönliche Kommunikation zur Verfügung steht.
Herr Abgeordneter, wir werden hier im Parlament nicht einzelne Personalfragen öffentlich diskutieren. Ich kann Ihnen aber sagen, es gibt niemanden, der für meine persönliche Kommunikation zuständig ist. Es gibt eine Pressestelle des Ministeriums, und die organisiert die Kommunikation. Und die ist auch absolut notwendig. Ich kann Sie nur darauf hinweisen, was DEWAL gerade vor kurzem im Meinungsmonitor noch mal deutlich gemacht hat. Noch nicht mal die globalen Nachhaltigkeitsziele sind schon über
care together. Inhumane and stupid. Granny's home dying and can't get home care if she can still get out into the yard or be driven to see the shore, to see Narragansett Beach, say, one more time, to recall childhood memories before she dies. Inhumane and stupid. Granny's home dying and the family's exhausted, and the respite care benefit is not to send a nurse or a caregiver, but to stuff Granny in an ambulance and haul her off to a hospital. Some respite. It's all expensive, frightening, inhumane, and stupid. But the insensate CMS bureaucracy takes a court order to be awakened to the harm they cause. I have had enough. CMS should let Rhode Island try humane end-of-life care through CMMI. Let's see if it works at a state. I bet it will save money, serve families better at a very, very delicate time, and perhaps even make a model for better health care everywhere. I've said a lot. My time is out. You're welcome to respond in writing. I ask unanimous consent that the order declaring CMS's actions to constitute irreparable and illegal harm be put into the record.
Without objection. Let me just respond very briefly, Senator Whitehouse. I'm an implacable enemy of tyrannical, insensate bureaucracies and stupid rules, and I will work with you to make CMS responsive to the needs of Rhode Island and to remedy those disparities that you talk about. I am familiar with the Integra Health plan, and it is the template for what we ought to be doing is a value-based plan. And I look forward to you to making sure that we create pilot programs like this.
Unfortunately, Mr. Chairman,
around the country.
Unfortunately, Mr. Chairman, one of the things I've learned in my tenure in the Senate is that a nominee saying that they're willing to work with me amounts to exactly zero. We need to get this fixed. Thank you.
Well, I guess at that point, then, we will move on to Senator Daines.
Mr. Chairman, thank you. Mr. Kennedy, I'm glad to see you here this morning. I listened to your opening remarks, and you mentioned that you want to make HHS the gold standard of science. I have found my engagements with you, both behind closed doors in my office, as well as listening to you publicly, to be very thoughtful and science-based. I applaud that. I thank you for that. And I realize this will likely be a very partisan vote on this committee and on the Senate floor. But let the record state there are 3 medical doctors on this side of the dais. I'm a chemical engineer. We believe in science. I'm thankful that you do too, and you made that comment in your opening remarks. I want to talk about agriculture for a moment. We talked about our common love for Montana. You've been to Montana many times. It's a wonderful state. A lot of folks have discovered it. They watch the show Yellowstone, and people are coming and moving into our state, but it's an amazing place. But as you know, agriculture is our top economic driver in Montana. We produce some of the highest quality crops, the best livestock in the country and the world. Our farmers and our ranchers are truly some of the most effective environmental stewards in ensuring we have a safe food supply chain in the world. I share your view that protecting the integrity and safety of our food supply is of utmost importance. I appreciate the research happening in places like Montana State University to help farmers produce resilient, healthy, and safe crops, as well as their agricultural practices. You mentioned you were a 4-H kid growing up. I think our 4-H kids and our FFA kids are some of the best kids in America. My question for you, Mr. Kennedy, is if confirmed, as I'm listening to my farmers and ranchers talk about the future, will you commit to working collaboratively with partners at USDA, at the relevant federal agencies, as well as our Montana farmers and ranchers, before implementing any policy that might affect or impact food supply?
Absolutely will make that commitment. I have, as I shared with you, a personal commitment and a long career working with farmers. I want to make sure I understand the very, very narrow margins, the slim margins that American farmers and ranchers are dealing with. And I don't want, under my watch, a single farmer to have to leave his farm for economic reasons or for regulatory or bureaucratic reasons while I serve, if I'm privileged to serve, to be confirmed as HHS Secretary. Even more important, President Trump has a very, very strong commitment to farmers. President Trump is probably historically, in modern history, the best farm president in our history. Farm income spiked for the first time in decades under his last administration. He got solid support from farmers across the country. Farm country is Trump country. Farmers across the country supported him during this election. He has specifically instructed me that he wants farmers involved in every policy, and that he wants me to work with Brooke Rollins at USDA to make sure that we preserve American farmers, that all of our policies support them.
Mr. Kennedy, thank you. And if confirmed, I look forward to having you and Brooke Rollins out to Montana to spend some time with
you. You have
farmers.
my commitment to come there anytime, particularly during ski season or hunting season.
Deal. I want to shift gears for a moment. As we discussed in the meeting we had in my office, mifepristone was approved in 2000. The FDA has been under scrutiny and brought to court for failure to properly assess this drug, as well as subsequent deregulations Senator Langford described that have occurred over the past 25 years. Some of these deregulations included ending the requirement that these drugs be prescribed by a doctor, ending reporting requirements for adverse events, and allowing these pills to be obtained through the mail. In fact, the FDA's own prescribing label mentioned that 3 to 5% of women taking this drug end up in the emergency room. My question is, if confirmed as Secretary of HHS, will you commit to working with the FDA Commission to review these deregulatory actions that are threatening the safety of women?
Sorry, Senator. As I said to Senator Langford, I think it's immoral to have a policy where patients are not allowed to report adverse events and where doctors are discouraged from doing that. President Trump has asked me to study the safety of mifepristone. He has not yet taken a stand on how to regulate it. Whatever he does, I will implement those policies, and I will work with this committee to make those policies make sense.
Thank you, Mr. Kennedy. Senator Hassan.
Thank you, Mr. Chair and Ranking Member Wyden, and welcome, Mr. Kennedy, and to your family as well. I want to start with a couple of concerns I have, and just briefly on Medicaid. States share in the funding of Medicaid. Millions of disabled children in this country are alive because of Medicaid. Millions of people with addiction in this country are in recovery because of the services provided to them by Medicaid. And millions of chronically ill people who, until Medicaid expansion was enacted, who couldn't get health care and therefore couldn't work because they were too sick, got health care through Medicaid expansion, then went back to work, and now they're on private insurance. So those are some facts about Medicaid that you might want to brush up on. Now, I'm also extremely concerned about your endorsement of radical fringe conspiracies that, if implemented at HHS, would put American families' lives at risk. Vaccines are one of our greatest public health triumphs. And you don't need, I'm not talking about abstract medical science. One of the people who helped raise me was my grandfather, who was a pediatrician. He practiced medicine in this country from 1921 until the mid-1980s. And I heard details about the difference those vaccines made in saving lives in the children who were under his care. Vaccination has helped to eradicate many deadly diseases in the United States, including polio and smallpox, something we should be proud of as Americans. I am extremely concerned that as Secretary, you would be able to halt critical vaccine research and to exploit parents' natural worries by advising them not to vaccinate their children. This will lead to more children getting sick, and some will even die. Before the measles vaccine, about 500 American children died a year from measles. This is too much of a risk for our country, and there is no reason that any of us should believe that you have reversed the anti-vaccine views that you have promoted for 25 years. For example, you have previously falsely suggested that the polio vaccine killed many, 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 many more people than polio ever did by causing fatal cancers, while rigorous safety studies show that to be completely false. Now, let's go to something we agree upon. I am really heartened to see that one area where we agree on is on women's reproductive freedom. In your own words, it's not the government's place to tell people what to do with their bodies. You said that, correct? Yep. Mr. Kennedy, in 2023, you came to New Hampshire and said, quote, I'm pro-choice. I don't think the government has any business telling people what they can or cannot do with their body. So you said that, right?
Yes.
Yep. But you also said we need to trust the women to make that choice because I don't trust government to make any choices. You said that too, right?
Yes.
It is remarkable that you have such a long record of fighting for women's reproductive freedom, and really great that my Republican colleagues are so open to voting for a pro-choice HHS secretary. So, Mr. Kennedy, I'm confused. You have clearly stated in the past that bodily autonomy is one of your core values. The question is, do you stand for that value or not? When was it that you decided to sell out the values you've had your whole life in order to be given power by President Trump?
Senator, I agree with President Trump that every abortion is a tragedy, that we can't be a moral authority in this country.
Right, so, but that isn't what you said back in New Hampshire in 2023. My question is exactly when did you decide to sell out your life's work and values to get this position?
Senator, I agree with President Trump that every abortion is a tragedy.
So what you're telling us, just to be clear, because my time is limited, is that regardless of what you believe, regardless of what values you have, if President Trump tells you to do something, you're going to do it. You said just now the discussion about mifepristone. Oh, he's asked me to study the safety of it. Here are the safety studies that tell us mifepristone is safe and effective. And I asked Mr. Chair that these about 40 studies be admitted to the record by unanimous consent.
Without objection.
So the studies are there. The safety is proved. The science is there. But what you're telling us is if President Trump orders you to take action to make it harder for women to get direly needed health care, you'll follow his order. If Mr. Trump, as he did yesterday, orders a halt on Medicaid payments that are essential for taking care of people with disabilities all around this country, you're going to follow that order because you are willing to sacrifice your values, your knowledge, if President Trump tells you to do that. That, to me, is unacceptable in a Secretary of Health and Human Services.
As I explained before, the White House has issued a statement saying that that policy will not deprive any American benefits.
The problem is the White House issued that statement only after we pointed out the damage it would do, and it became politically uncomfortable for them. You know what else that freeze on federal funding did? It halted funds for critical research that could cure pediatric cancer. So if the president tells you to do that, you're going to stop that too. That's enough.
Thank you. Senator Cortez Masto is next.
Thank you.
Mr. Kennedy, thank you for coming into my office and having the conversation that we did. I appreciate your passion and your belief, and you've spent years really talking about the issues that matter to you, and I appreciate that. Let me ask you a couple of questions, though I just need some clarification. Right now, there's a 40-year-old law that requires hospital ERs accepting payment from Medicare to actually provide emergency care to patients. So let's say a woman experiencing a life-threatening condition like a heart attack goes to the ER. As a lawyer, you would agree that that federal law protects her right to emergency care, correct?
Yes.
So now a pregnant woman with life-threatening bleeding from an incomplete miscarriage goes to the ER. Let me rephrase that so you can hear. A pregnant woman with a life-threatening bleeding from an incomplete miscarriage goes to the ER, and her doctor also determines that she needs an emergency abortion. But she's in a state where abortion is banned. You would agree also as an attorney that federal law protects her right to that emergency care, correct?
I don't know. I mean, the answer to that is I don't know if the state bans
Well, let me ask you this as an attorney. Doesn't federal law preempt state law?
The federal Constitution does. Sometimes not every federal law preempts state laws. It could be unconstitutional. Now, I'm not trying to be evasive, Senator. I'm just telling you I don't know the answer
appreciate
to that question.
But what authority do you have over this as the director of HHS?
What authority do I have?
Yeah, to enforce the law.
In what regards?
To make sure that a hospital that receives payment from Medicare is ensuring that they're providing the necessary emergency care to patients when they present. It's actually the EMTALA law. So what authority as HHS director do you have with respect to EMTALA?
My understanding is that I have budgetary power and that it's pretty much limited to that. But if you tell me I have another authority, I don't even think that.
Well, let me tell you,
we have a law enforcement branch at HHS.
Actually, you do, and that's CMS. CMS actually investigates complaints of EMTALA violations, as well as the Health and Human Services Inspector General, who, by the way, was just recently fired by Donald Trump. So you will be enforcing EMTALA laws, and it's important that you understand their impact and don't play politics with the patient presenting at the ER based on a position that this administration has taken. Let me ask you another question. When we met in my office, you said about lowering drug prices, that when Big Pharma price gouges, the American people suffer. I think we both agree on that. And I think you're sincere in your belief that you want to reduce prices for Americans, correct?
Yes.
Yeah. The Inflation Reduction Act empowered Medicare to negotiate prescription drug prices. It penalizes drug companies for price hikes above inflation, and it caps seniors' out-of-pocket drug costs, along with reducing insulin prices to $35 per month. But your future boss, Donald Trump, on his first day in office, revoked President Biden's executive order that actually directed the health secretary to examine ways to reduce drug prices and improve access to innovative therapies for the American people. And unfortunately, Republicans in Congress want to repeal the Inflation Reduction Act, which means reversing all of those things that we worked on to lower prices for Americans. So my question to you is, what do you do? Why are you there? Are you there to be a rubber stamp to this administration and cave into all of these positions that they're taking, even though you know they're in disagreement with your positions on lowering drug prices and that they could harm Americans? How do you handle that as HHS director?
Senator, my understanding is that the White House issued an executive order, I believe today, supporting the drug negotiations under the IRA. President Trump was very aggressive during his first term about negotiating drug prices. He has instructed me, and I've met with him repeatedly on is that we need lower prices than seniors in this country, and
So let me ask
others
you,
are.
let me ask you this, because I only have so much time. So we've already negotiated lowering prices for 10 drugs with Big Pharma. And Big Pharma, by the way, opposes this. They have not only are asking for a pause, they have filed lawsuits, but we've already negotiated the first 10 drugs. And we want to expand it to the next 10 to 15 that the Biden administration has put forward. Would you agree and continue that path of really mandating that Big Pharma come to the table and negotiate drug prices for Medicare so we can lower those prices for Americans?
My understanding is that the executive order that was issued today, which I haven't seen, but I've read a summary.
Well, let me ask you this then, because you keep citing the Trump administration and you're just going to follow what they say. Is that what you're doing? You're just a rubber stamp for them in this position? So anybody, so it doesn't matter that you're before us. It could be anybody coming before us as long as they're a rubber stamp for this administration and disregarding your beliefs and what you think. I guess my question to you is, if it really is fundamental to what you believe, how do you live with that? How do you address those issues as you're moving forward, knowing that it's going to harm Americans? Yeah.
You want me to answer the question?
No, I'm asking you.
Okay. President Trump has asked me to end the chronic disease epidemic and make America healthy again. And I'm
So
in
is
a
that
unique
the only reason why
position.
you're at HHS? Is that the only reason why then you're at the HHS, to address that one issue?
President Trump has asked me because I'm in a unique position to end that. And that is what I'm doing. And if we don't solve that problem, Senator, all of the other disputes we have about who's paying, and whether it's insurance companies, whether it's providers, whether it's HMOs, whether it's patients or families, all of those are moving deck chairs around on the Titanic. Our ship is sinking. Our 60% increase in Medicaid over the past 4 years is the biggest budget line now, and it's growing faster than any other. And no other nation in the world has what we have here. No other nation has a chronic disease. We have the highest chronic disease burden of any country in the world. We had, during COVID, we had 16% of the COVID deaths in a country. We only have 4.2% of the world's population. We had a higher death count than any country in the world. And when CDC was asked why, they said it's because Americans are the sickest people on earth. The average person who died from COVID, American, had 3.8 chronic diseases. This is an existential threat economically, to our military, to our health, to our sense of well-being. And it is a priority for President Trump. And that's why he asked me to run the agency. And if I'm privileged to be confirmed, that's exactly what I'll do.
Senator Barrasso.
Thanks so much, Mr. Chairman. Mr. Kennedy, thank you for taking time to visit with me in my office prior to today's hearing to talk about a lot of the important issues affecting health care in my home state of Wyoming, as well as the nation. And I appreciate your willingness to serve our country. During our meeting, we discussed the challenges that healthcare providers and patients are facing in rural America. Financial obstacles facing rural hospitals, workforce shortages, issues of OBGYN, and then new regulations that are painful that have come out of the Biden administration, hurting our ability to provide nursing home staffing. So let me start, if I could, with rural hospitals and the closures of hospitals like that. There are a lot of challenges facing hospitals in rural communities and frontier areas. We have 33 hospitals in Wyoming. 26 are really located in various locations, often hard to get to. Weather impacts them. 6 of the hospitals are at risk of closing. 2 are at immediate risk of closing in the next 2 years. 10 have had to cut available services. And this is a concern of rural hospitals in both Republican and Democrat states, either way, bipartisan. Critical that the workforce challenges, financial challenges that we're facing are addressed. Can you commit to working with us on a plan to address the critical nationwide issue of rural health care?
Yes, yes, Senator. And I would say that during my visits, I visited almost 60 senators so far. And the most common unifying, I would say, issue among both Democrats and Republicans, there were 2. One was PBM reform, and the other is rural hospitals. And You know, our nation made a commitment over 100 years ago to put up a hospital within 30 miles of every American. We generally succeeded in doing that. It's absolutely critical. It's life-saving. And rural hospitals are closing at an extraordinary rate right now. They not only provide important health care for the localities, but also they're economic drivers for localities all over this country. President Trump is determined to end the hemorrhage of rural hospitals, and he's asked me to do that through use of AI, through telemedicine, which these are innovations that I saw the other day. A Cleveland clinic has developed an AI nurse that you cannot distinguish from a human being, that has diagnostics as good as any doctor. And we can provide concierge care to every American in this country, even those, the remote parts of Wyoming, Montana, Alaska, et cetera. We also have opportunities at HRSA and at the GME to finally live up to GME's mission of providing personnel to rural hospitals. And I intend to use all of my power, because I've seen the priority that is given by both Democrats and Republicans on this committee. I intend to make that a priority if I'm privileged to be confirmed.
Well, I appreciate it, because often with financial strains on a local hospital, one of the common services to be cut in rural hospitals is maternity services. So now we have women in Wyoming having to drive over 100 miles to access care. 13 counties in Wyoming don't have access to OB. And we're talking counties larger than the states of Vermont, New Hampshire, Rhode Island, Connecticut, New Jersey, Delaware, counties larger than those whole states. So will you commit to working with my office to find solutions to help address these specific maternal health challenges in rural America?
Yes, Senator, I look forward to it.
Another issue we specifically spoke about with this harmful Biden administration rule that have really been bad for our rural nursing homes. And it's a rule that would triple the registered nurse requirements in nursing homes. This is going to lead, there just aren't enough registered nurses in our state to be able to comply with this. This would lead to nursing home closures across our state. Will you commit to working with me to fix this serious problem that it was a result of a rule that came out by the Biden administration, who clearly doesn't understand rural America?
Yes, Senator, I think the rule was well-intentioned, but as you've said, and I've heard from many rural senators, it will be a disaster for their states. Some of the nursing homes, these are staffing rules that require 24-hour staffing by medical professionals. Some of the nursing homes in rural areas simply do not have the available personnel or the economics to be able to do that. It will mean the closure of nursing homes in rural areas across our country, which means the parents, elderly parent, will be moved a great distance from the local community and their family. And we know that the single greatest driver of high-quality nursing home care is the involvement, the proximity of family members. When you move that nursing facility away from the community where the kids live, you're going to get much worse care. So the intention, although it was noble, was in reality, for rural areas at least, it is going to be a disaster.
Thank you. Thank you, Mr. Chairman.
Thank you. Senator Johnson.
Mr. Kennedy, welcome. Thank you for being here. Thank you for your decades-long advocacy for a clean environment, for children's health. I can't say as I'm surprised by the hostility on the other side. I'm highly disappointed in it. I don't know if you remember when you called me up and you were contemplating setting your political differences aside, joining forces with President Trump on an area of agreement, addressing chronic illness, trying to find the root cause of all these problems facing this nation. And my first response was, Bobby, this is an answer to my prayers. We need to get to the answers of this, but even more, we need to heal and unify this divided nation. I'm not necessarily the most optimistic guy because we've got enormous challenges facing this nation. But I thought, wow, here's somebody from the left, somebody I don't agree with on many issues politically, coming together with President Trump and focusing on an area of agreement, something that the American people desperately want. Finding out the answers. What has caused autism? What is causing chronic illness? Ms. Kennedy, I think I've come to know what's in your heart. I think I know the personal and political price you've paid for this decision. I want to say publicly, I thank you for that. I truly appreciate what you're doing here. Can't we come together as a nation and do this? Can we do? Aren't you getting tired of this? I'm getting tired of this. So again, Ms. Kennedy, I need to enter in the record. These are just 11 letters of support signed by 63,000 people, thousands of doctors. From the American Association of American Physicians and Surgeons, Independent Medical Alliance, the North Carolina Physicians and Freedom Group, Governor Jeff Landry from Louisiana. These are Americans, nonpartisan. A lot of these people, I know because I've advocated with you. A lot of them are Democrats. They put their political differences aside. So, Mr. Chairman, I'd like to enter this in the record.
Without objection.
I also do want to, Mr. Kennedy, as long as I have you here, I've written over 70 oversight letters to the federal health agencies under the Biden administration. I've virtually gotten squat out of them, okay? What I get is we get, for example, 50 pages of Anthony Fauci's emails redacted. Oh, by the way, the latest one was 17 pages. Instead of issuing a health alert on the myocarditis they knew was impacting young men early in 2021, instead of issuing an alert on the Health Alert Network, they developed 17 pages of talking points. This was given to the public under a FOIA request. They had to go to court. They've got a new way of redacting. They don't black things out. They just give you white pages, so you don't even know what they have redacted. So again, I've issued a subpoena now to cover the information I've requested in 70 oversight letters. My question to you is, as Secretary of HHS, will you honor these requests from Congress, and will you make HHS transparent?
Yeah, my approach to HHS, as I said before, Senator, is radical transparency. Democrats and Republicans ought to be able to come in and get information that was generated at taxpayer expense, that is owned by the American taxpayer. They shouldn't get redacted documents. Public health agencies should be transparent. And if we want Americans to restore trust in the public health agencies, we need transparency. I want to say something about what you first said. When I launched my campaign, it was about uniting Americans, Democrats and Republicans. There's no issue that should unite us more than this chronic health epidemic. There's no such thing as Republican children or Democratic children. These are our kids. 66% of them are damaged. I know what a healthy kid looks like because I had so many of them in my family. I didn't know anybody with a food allergy growing up, peanut allergy. Why do 5 of my kids have allergies? Why are we seeing these explosions in diabetes, rheumatoid arthritis, neurological diseases, depression, all of these things that are related to toxics in the environment? Why can't we just agree with each other to put differences about so many issues, intractable issues aside, and say, we're going to end this? I don't think anybody is going to be able to do this like I have because of my peculiar experience, because I've litigated against these agencies. When you litigate against them, you get a PhD in corporate capture and how to unravel it. I've written 6 books about these agencies. I know a lot about them, and I know how to fix it. And there's nobody who will fix it the way that I do, because I'm not scared of vested interests. I don't care. I'm not here because I want a position or a job. I have a very good life and a happy family. This is something I don't need. I want to do this because we're going to fix it. And the other thing is we are attracting now a caliber of people to HHS like never before in history. And they're entrepreneurs, they're disruptors, they're innovators of immense talent that are walking away, many of them, from growing concerns. They're not coming there for position. They're coming there because they want to save our country. And they're from across the political spectrum. And all these Democrats are opposed to me for partisan issues. They used to be my friends, agreed with me on all the environmental issues that I've been working on for my whole career. Now they're against me because anything that President Trump does, any decision he makes, has to be lampooned, derided, discredited, marginalized, vilified.
We need to move on. Senator Warren.
Thank you, Mr. Chairman. So, Mr. Kennedy, I want to start with something that I think you and I agree on, and that is that Big Pharma has too much power in Washington. You've said that President Trump asked you to, quote, clean up corruption and conflicts. Sounds great. You've said that you will, quote, slam shut the revolving door between government agencies and the companies they regulate. That also sounds great. So here's an easy question. Will you commit that when you leave this job, you will not accept compensation from a drug company, a medical device company, a hospital system, or a health insurer for at least 4 years, including as a lobbyist or a board member?
Can you just repeat the last part of the question? Can I commit
You're
to
not going to take money from drug companies in any way, shape, or form.
Who? Me?
Yes, you.
Oh. Yeah, I'm happy to commit to that.
Okay, good. That's what I figured. I said it's an easy question to start with. And I think you're right on this question.
I don't think any of them want to give me money, by the way.
Let's keep going. You're right because to say yes, because every American has the right to know that every decision you make as our #1 health officer is to help them and not to make money for yourself in the future. So I want to talk more about money. I'm looking at your paperwork right now. In the past 2 years, you've raked in $2.5 million from a law firm called Wisner Baum. You go online, you do commercials to encourage people to sign up with Wisner Baum to join lawsuits against vaccine makers. And for everyone who signs up, you personally get paid. And if they win their case, you get 10% of what they win. So if you bring in somebody who gets $10 million, you walk away with $1 million. Now, you just said that you want the American people to know you can't be bought. Your decisions won't depend on how much money you could make in the future. You won't go to work for a drug company after you leave HHS. But you and I both know there's another way to make money. So, Mr. Kennedy, will you also agree that you won't take any compensation from any lawsuits against drug companies while you are secretary and for 4 years afterwards?
Well, I'll certainly commit to that while I'm secretary. But I do want to clarify something because you're making me sound like a shill. I put together that case. I did the Science Day presentation to the judge on that case to get it into court, the Daubert hearing.
Mr. Kennedy, it's just a really simple question.
Yeah,
You've taken in $2.5 million. I want to know if you will commit right now that not only will you not go to work for drug companies, you won't go to work suing the drug companies and taking your rake out of that while you're secretary and for 4 years after. It's just...
I'll commit to not taking any fees from drug companies while I'm secretary.
No, I'm asking about fees from suing drug companies. Will you agree not to do that?
You're asking me to not sue drug companies,
no,
and I'm not going to agree to that,
Senator.
Senator.
Drug companies as much as you want.
I'm not going to agree to not sue drug companies or anybody.
So let's do a quick count here of how, as Secretary of HHS, if you get confirmed, you could influence every one of those lawsuits. Well, let me start the list. You could publish your anti-vaccine conspiracies, but this time on U.S. government letterhead, something a jury might be impressed by. You could appoint people to the CDC vaccine panel who share your anti-vax views and let them do your dirty work. You could tell the CDC vaccine panel to remove a particular vaccine from the vaccine schedule. You could remove vaccines from special compensation programs, which would open up manufacturers to mass torts. You could make more injuries eligible for compensation even if there is no causal evidence. You could change vaccine court processes to make it easier to bring junk lawsuits. You could turn over FDA data to your friends at the law firm, and they could use it however it benefited them. You could change vaccine labeling. You could change vaccine information rules. You could change which claims are compensated in the vaccine injury compensation program. There's a lot of ways that you can influence those future lawsuits and pending lawsuits while you are Secretary of HHS. And I'm asking you to commit right now that you will not take a financial stake in every one of those lawsuits so that what you do as Secretary will also benefit you financially down the line.
I'll comply with all the ethical guidelines.
That's not the question. You and I, you have said
You're asking me, Senator, you're asking me not to sue vaccine pharmaceutical companies. Yeah, you are. That's exactly what you're doing.
Look, no one should be fooled here. As Secretary of HHS, Robert Kennedy will have the power to undercut vaccines and vaccine manufacturing across our country. And for all of his talk about follow the science and his promise that he won't interfere with those of us who want to vaccinate his kids, the bottom line is the same. Kennedy can kill off access to vaccines and make millions of dollars while he does it. Kids might die, but Robert Kennedy can keep cashing in.
Senator, I support vaccines. I support the childhood schedule. I will do that. The only thing I want is good science, and that's it.
How about then say you won't make money off what you do as Secretary of HHS?
Before we go to Senator Tillis, I think would be important for me to make it very clear that Mr. Kennedy has gone through the same Office of Government Ethics process as every single other nominee in the Finance Committee this year and in previous administrations. In addition to listing his assets, including the items that you've identified, he has signed an ethics letter that has been reviewed by the Office of Government Ethics concerning any possible conflict in light of its functions and the nominee's proposed duties. And we have a letter from the Office of Government Ethics that he hasn't complied completely with all applicable laws and regulations governing conflicts of interest.
Mr. Chairman, point of information here. Have we had a single nominee come through who's made $2.5 million off suing one of the entities that it would be regulating and plans to keep getting a take of every lawsuit in the future? Have we had that before?
I haven't reviewed the past documentation of every other nominee's financial interests, and so no. But I know that every single time we get a nominee, their financial interests are attacked. That's why we have the Office of Government Ethics. That's why they've reviewed everything that's in his record, and that's why he has even, I think, and I don't know that I want to ask him to get into it, but he has listed his assets and has gone through a discussion of the responsibilities under our ethics laws and is complied with all of those requirements. Senator Tillis.
Thank you, Mr. Chairman. Mr. Kennedy, how's your morning going?
So far, so good.
Good. You came prepared. I'm glad that you did. You, I believe, addressed to my satisfaction a question about Title X and the President's priority with respect to Planned Parenthood. Can you just affirm that you are 100% behind the President's policy on Title X and the implementation?
I'm 100% behind it, Senator.
Thank you. You know, it's amazing to me that people, well, first off, you need to understand I was in a judiciary hearing this morning. It's very clear to me that some of these nominations are going to be shirts and skins. So no matter what you answer in the affirmative, they're going to ask you one more question so that you won't be able to answer in the affirmative. That's just the way the game gets played when we have nominees like yourself. So I think you're handling yourself well. I got a real quick question for you. Are you a conspiracy theorist?
That is a pejorative, Senator, that's applied to me, mainly to keep me from asking difficult questions of powerful interests. I was told that I was a conspiracy theorist. That label was applied to me because I said that the vaccines, the COVID vaccine, didn't prevent transmission and it wouldn't prevent infection, when the government was telling people, Americans, that it would. I was saying that because I was looking at the monkey studies in May of 2020. I was called a conspiracy, now everybody admits it. I was called a conspiracy theorist because I said red dye caused cancer. And now FDA has acknowledged that and banned it. I was called a conspiracy theorist because I said fluoride lowered IQ. Last week, JAMA published a meta-review of 87 studies saying that there's a direct inverse correlation between IQ loss.
All right, so I'm going to assume
I could go on for about a week.
So is there any one of them that you can say, you got me? That really was a conspiracy theory, or are you in a position to submit for the record? I think it'd just be helpful for every one of these narratives for you to submit that maybe for the record. You said something about SNAP lunch. I was in the State House in North Carolina before I came here, and anytime I'd go visit an elementary school, the first thing I would do is go to the trash cans in the cafeteria. And what we have now are kids that are not eating the food because the dictates of the federal government have made it something that they don't want. But they say, well, it's a healthy alternative. It has processed materials in it, and it's not particularly attractive to them. So they throw it away. Trash cans full of food that these kids didn't eat. So then what do? They go eat snacks, or they go eat or they drink a sugared drink. The SNAP program, everything you've said about the SNAP program, I agree with. I think that we should be very, very strict about that, and it's going to make some people uncomfortable in the food manufacturing segment, produce healthy foods that we can put in the SNAP program. That's the way to address it. But we also need to look at the school health program. I was PTA president 22 years ago at my daughter's high school, and I feel like we've got these kids that need help. We've got to guide them through a process. Many of them are probably on Medicaid, and Medicaid's failing them. Everybody here says Medicaid is sacrosanct. Nobody's admitted that Medicaid is not producing positive health outcomes. Is that your problem in Medicaid right now, the program or the outcomes?
It's the outcomes. We're spending $900 billion, and our people are getting sicker every single year.
Yeah, so anybody
and President Trump wants people to have it, Americans to have a high-quality insurance.
Anybody who's building a case for the status quo of Medicaid is by extension saying that they're happy with the outcomes. I think it's unacceptable. I do have a question for you on Project Warp Speed. We supported the CARES Act. We had 97 people in the U.S. Senate vote for it. Everybody here. There's only one member of Congress that voted against it, I believe. And Project Warp Speed had CDC, FDA, NIH, and BARDA very much in the mix. Now, some people think that you're going to come in here and insert yourself into those agencies in a way that's never been done before. Let's say that they're a part of a future Project Warp Speed. Is it your intent to go in and do something that's never been done before based on my staff's research and insert yourself in a discussion that the scientists are dealing with in those different agencies?
No, Senator. What I want to do is, I'm not a scientist. I want to empower scientists. I want to make sure that science is unobstructed by vested or economic interests.
That's good.
Or by bad culture. And I'll just say about Operation Warp Speed, it was an extraordinary accomplishment, demonstration of leadership by President Trump. When he promoted Operation Warp Speed, he was looking at all of the different remedies, including vaccines.
Therapeutics, everything.
Therapeutic, ivermectin, hydroxychloroquine, famotidine, even chlorine dioxide. And he was not looking at shutting down our country for the year, forcing people to wear masks for a year. forcing all social distancing that did not have any scientific basis, which Dr. Fauci has now acknowledged. He said we took it out of thin air. But all of those changed during the Biden administration. And it became very narrowly focused. We ended up with the worst, the highest death count of any country in the world.
Mr. Chair, if I can just ask one final question, and I think it's a one-word answer. I've heard a lot of people complaining about health care delivery, Medicaid. On the other side of the dais here, who's been responsible for health care policies over the last 4 years?
The Biden administration.
I mean the president, the Biden, okay. Yeah. So that I'd like to have heard more of those in oversight hearings over the last 4 years. I haven't, but I'm glad that there's an acknowledgement that you're inheriting a problem that needs to be fixed. Thank you.
Thank you, Senator.
Senator Sanders.
Thank you, Mr. Chairman. Mr. Kennedy, thanks for being with us. I very much like the slogan that you coined, Make America Healthy Again. And I strongly agree with that effort. Despite spending, as you indicated, 2 or 3 times as much per capita on healthcare as other nations, we have 85 million people who are uninsured, underinsured. We have all kinds of chronic illnesses. Our life expectancy is lower than other countries. And for working class people in this country, they are living 6, 7 years shorter lives than the top 1%. We got a problem, okay? And I'm gonna suggest some ideas that I think can remedy that. Last year, the insurance industry in this country made over $70 billion, while at the same time, 85 million Americans are uninsured or underinsured. Do you agree with me that the United States should join every other major country on earth and guarantee health care to all people as a human right? Yes? No?
Senator, I can't give you a yes or no answer to that question.
Health care a human right? Is health care a human right?
In the way that free speech is a human right,
yeah.
I would say it's different because with free speech doesn't cost anybody anything, but in healthcare, if you smoke cigarettes for 20 years and you get cancer, you are now taking from the pool. Well, and so are you guaranteed the same right, or is there also a duty?
I'm sorry, I'd love to talk for an hour with you. We got a few minutes left here. All right. Every other country on earth says healthcare, whether you're poor or rich, young or old, is a human right. I'm not hearing you say that. All right, you've talked about the drug companies, and maybe we agree on this one. As you all know, despite the drug companies making over $100 billion in profits, paying CEOs outrageous compensation packages, we in some cases pay 10 times more for the same drug. Will you support legislation that I will introduce which says that in America we should not be paying a nickel more for prescription drugs than people around the rest of the world? Yes, no?
To equalize it?
Not to equalize it, that we should not be paying more than other countries for the same damn drug.
President Trump has asked me, in fact, I had a meeting with President Trump a week ago where we showed him the charts.
He knows the charts.
We're paying 10 times more from Europe.
That's right. And are you going to commit to us that you will end that absurdity?
I think in principle we can. We should end that disparity.
Good. Okay. That's great. All right. I happen to believe that climate change is real, it's an existential threat, and it is a healthcare issue. Donald Trump thinks that it is a hoax originating in China. Question is, in your judgment, is climate change a hoax or is it real, causing devastating problems?
President Trump and I, from the beginning, from our first meeting, agreed to disagree on that issue. I believe climate change is existential. My job is to make Americans healthy again.
All right, you believe that, you disagree with Trump, you don't think climate change is a hoax, is what I'm hearing.
My job here is to make
Americans
healthy.
I'm just asking you that, Mr. Kennedy, not a trick question.
I answered your question, Senator Sanders.
Okay, you disagree with the president on that.
I answered your question.
Okay. I'm going to pick up on a point that Senator Hassan made. Look, there is no question that abortion is a divisive issue in this country. I would say a majority of the people are pro-choice. There's a strong minority who are pro-life. A year and a half ago, you went to New Hampshire, running for president, gave a speech, and you talked about government should not tell a woman what she can do with her own body. That's her choice. Now, I think everybody on that side is pro-life. I think everybody here is pro-choice. I have never seen any major politician flip on that issue quite as quickly as you did when Trump asked you to become HHS secretary. Tell me why you think people should have confidence in your consistency and in your word when you really made a major U-turn on an issue of that importance in such a short time.
Senator, I believe, and I've always believed, that every abortion is a tragedy.
But you told the people in New Hampshire that it was their right. All right, let me do a last question here because I'm running out of time. I think the gist of what you're trying to say today is you're really pro-vaccine, you want to ask questions. You have started a group called the Children's Health Defense. You're the originator. Right now, as I understand it, on their website, they are selling what's called onesies. These are little things, clothing for babies. One of them is titled Unvaxxed, Unafraid. Next one, and they're sold for $26 a piece, by the way. Next one is No Vax, No Problem. Now, you're coming before this committee and you say you're pro-vaccine. Just want to ask some questions. And yet your organization is making money selling a child's product to parents for $26.
Du willst dein Auto in Zahlung geben? Stopp! Bei wirkaufendeinauto.de kannst du mehr für dein Auto bekommen. Also, wie viel ist dein Auto wirklich wert? Gib einfach deine Autodetails ein und erhalte den besseren Verkaufspreis. Vergleichen lohnt sich. Hol dir jetzt den Preis für dein Auto auf wirkaufendeinauto.de.
That was just a few months ago. You founded that. You certainly have power. You can make that call. Are you supportive of this?
I've had nothing to do with
leadership. Are you
leadership.
supportive of these onesies?
I'm supportive of vaccines.
Are you supportive of this clothing, which is militantly anti-vaccine?
I am supportive of vaccines. I will. I want good science, and I want to protect.
But you will not tell the organization you founded not to continue selling that product. Thank you, Mr. Chairman.
Senator Blackburn.
Thank you so much, Mr. Chairman, and thank you so much for being with us today. And I have no doubt that you will be confirmed and you are going to do such a solid job for the people of this country. And I do have several issues I wanted to talk with you about and didn't have time to cover them all when we met prior to the meeting, but rural health care is very important to me and the people of Tennessee. 78 of our 95 counties are rural counties. Now, over the last few years, we've seen hospital closures. So we have focused on access in rural areas. And my rural health agenda, which is bipartisan, focuses on innovation, telehealth, access points. It focuses on work shortages. And also, Senator Warner and I have together focused on making certain that we address the area wage index and do that fairly for our citizens that are in rural communities. So I would like a commitment from you that when confirmed, you and your CMS administrator will work with us to make certain that the area wage index is balanced and that it is fair to rural areas.
Senator, both Dr. Oz and myself recognize that rural health care is in crisis in this country, and that is catastrophic for our entire country. And I talked a little bit about my commitment to rural health earlier in this hearing. The regional price points, as you know, are set by Congress and not by HHS. I will
CMS.
certainly, and I know Dr. Oz will certainly work with you to make them sensible.
We look forward to that. Also, you and I, before you came forward as the secretary, the nominee, we had talked in years past about over-medicating youth and concerns over that. And I was looking at a report from TennCare, which is our Medicaid program in Tennessee. And I was concerned when I saw a number that TennCare had spent $90 million in 2024 alone on ADHD. This was 417,000 of our children. And $90 million, to me, that is heartbreaking, what is happening there. So how will you prioritize oversight of prescribing practices while promoting alternative solutions such as counseling, behavioral therapies, community-based interventions for our youth?
Exactly, and that's the solution. 15% of American youth are now on Adderall or some other ADHD medication. Even higher percentages are on SSRIs and benzos. We are not just over-medicating our children, we're over-medicating our entire population. Half the pharmaceutical drugs on Earth are now sold here. 70% of the profits from pharmaceutical companies are from the United States, even though we only have 4.2% of the world's population. Not only that, but a recent study by Cochrane Collaboration founder Peter Ghosh found that pharmaceutical drugs are the third largest cause of death in our country after heart attacks and cancers. Oh, they're not making us healthier. We need community health initiatives. We need access to treatment. We need exercise. We need better food.
Okay, let me talk to you about one of those access points in treatment. And this highlights a problem we have in the federal Medicaid law. Since Medicaid's enactment, states have been prohibited from using Medicaid funds for care provided by institutions for mental disease. We refer to them as IMDs. These are psychiatric hospitals, residential treatment facilities with more than 16 beds. This is a discriminatory exclusion, and it denies payment for medically necessary care based on the illness that is being treated, and it has perpetuated unequal coverage in mental health care. So if you're confirmed, when you're confirmed, will you commit to working with me on repealing this discriminatory exclusion and ensuring equal access to mental health care for Medicaid beneficiaries?
Yes, Senator.
Thank you so much. I've got a question on PBM reform, one on artificial intelligence in healthcare. In the interest of time, I will yield back. I look forward to seeing you help make us healthy again.
Thank you, Senator.
Senator Lujan.
What? No. You're next. I'm next.
Excuse me, I made a mistake. It's Senator Cantwell.
Thank you so much. Thank you, Mr. Chairman, and congratulations on your nomination, Mr. Kennedy. And I've been absent only because I've been in another hearing with the nominee to be the Commerce Secretary. So I will review everything that you've said today and look at that diligently. But one of the things that I wanted to discuss with you is I represent a very big innovation state, and innovation in healthcare specifically. Innovation like NIH funding to the Fred Hutch Cancer Center that helped develop the HPV vaccine, which has the potential to eliminate over 95% of cervical cancer. NIH also funds a lot of jobs and grants, nearly 11,000 people in the state of Washington, and over $1.2 billion worth of grants. So while I agree with you on healthy foods, I definitely am troubled by the medical research side of innovation and some of the things that you have said. In fact, this issue about laying off 600 employees at NIH, or giving the fact that, to quote, give infectious disease a break for 8 years. So we've had a chance to talk about this a little bit, but the most striking example of this is when COVID hit. And we were the first in the nation. We had the first case, and it really was the fast response by the University of Washington that really helped save lives. So I just want to know that, are you aware of how harmful these issues could be for public health? That public health in and of itself could be affected by these kind of anti-science views?
Senator, I have always been a science person, a pro-science person. I believe in evidence-based medicine and gold standard science. When I said, and I've explained this before you came in, that 600 people out of a workforce of 91,000 is pretty typical. Last year alone, President Biden replaced 3,000 people at HHS and 700 at NIH. I want to say this. I said give infectious disease a break because that's been the principal preoccupation. Infectious disease, chronic disease is 92%, accounts for 92% of deaths in this country, and almost nothing is studied at NIH about the etiology of our chronic disease epidemic.
But right now,
the money is going to infectious disease.
But I get your point. It's an interesting point. The problem is, we had to respond, and it's actually the Gates Foundation and a flu cohort that figured out what was wrong, and that we had an outbreak of COVID that was going beyond the very first case. And so we had to build a very fast response. So I take this too. The University of Washington has conducted groundbreaking stem cell research on fetal tissue. To me, I know there's probably a lot of people that may not agree with this, but we're making regenerative heart tissue now at the University of Washington. So yes or no, do you commit to protecting stem cell research for scientific agencies if confirmed?
I will protect stem cell research. Stem cell research today can be done on umbilical cords, and you don't need fetal tissue.
You'll protect the laws that are on the books today and the research that's done.
My job is, Senator, to enforce the laws.
Okay, so I want to move to PBMs because PBMs are driving up drug prices. And one of the biggest things that we need to do here, I think, in a new administration is get a handle on everything that is driving up prices and lower them. The report found that PBMs generated $1.4 billion from spread pricing. That is where they are able to basically set the price, not reimburse pharmacies, and then pocket the rest. We've had bipartisan legislation in several different committees now to get at this. What do you think the solution is?
I think one of the really notable achievements of this panel was the PBM legislation that they put together in a bipartisan way. I haven't met a single senator, well, actually one only, but of the 60-odd senators that I talked to, all of them talked about PBMs and how important it was, and President Trump, during his first administration, pushed through a law, or pushed a law to give transparency to PBMs. It got overruled during the Biden administration. Luckily, this panel is resuscitating that. President Trump is absolutely committed to fixing the PBMs.
My time is running out, so I just want to clarify. You believe that we should pass these laws that now have been proposed in the Senate?
I haven't read the entire law, so I don't know, but I think that we need to reform the PBMs. I think we need to get rid of all of these vested interests that are draining money from the system.
Okay, somebody suggested, though, that you thought you should convene the PBMs and talk to them about some sort of self-regulation. So I am trying to distinguish between these people who basically are doing illegal activities and ripping off, really they're creating pharmacy deserts in my state. So I'm asking you whether you believe that we have to legislate in this area.
Again, I'm not being evasive. I just don't know exactly what the law says. I met with the PBMs. I met with pharma. My job is to meet with all the stakeholders. I've been meeting with stakeholders for 40 years. People I was suing, you want to hear from the other side.
Well, it's,
That doesn't mean I would let the PBMs write their own ticket.
I think
I support the efforts of this committee to come up with bipartisan legislation. President Trump wants to get the excess profits away from the PBMs and send it back to primary care, to patients in this country, to high-quality health care.
I'll ask you for the record, since my time's expired, to look at the legislation that came out of the Commerce Committee that defines the legal activities that they are doing to drive up prices, and get us an answer for the record. Thank you, Mr. Chairman.
In principle, I support that legislation.
Thank you. And let me just tell you the list as we have to move forward to the ending here. Senator Lujan will be next, followed by Senator Marshall, Senator Warnock, Senator Smith, Senator Young, and Senator Welch.
And let me say again, Mr. Chairman, this is a matter of such importance. A number of my colleagues would like a second round, and I think it would be important to offer, say, a modest amount of additional time to get into this on both sides. I know I have some questions, but I want my colleagues to have the opportunity to raise their concerns as well.
Well, I've said, as I have indicated to you, Senator Wyden, I'm not going to do a second round. I have been very generous with the senators. I think almost every single senator has had 7 minutes at least. And I will give you a second, as is our practice between the two of us.
I'll then divide my time up with my colleagues.
Okay, you are welcome to do that.
Thank you.
Senator Lujan.
Thank you, Mr. Chairman. Mr. Kennedy, when we met, you stated to me that it is not your goal to take away programs that work for Americans. Do you stand by that statement?
Yes, Senator.
Mr. Kennedy, do you know how many Americans rely on Medicaid?
It's about 72 million plus the 7 million kids who are on chips.
Appreciate that, 72 million. Yes or no, is it important that expectant mothers and newborns have access to health coverage? Is it important that expectant mothers and newborns have access to health coverage?
Absolutely, Senator.
Mr. Kennedy, do you know how many babies born in this country are covered through Medicaid?
I would guess, I don't know the answer, I would guess about 30 million.
I have it, Mr. Kennedy. About 41% or 1.4 million babies births are financed by Medicaid, according to the National Center for Health Statistics. Yes or no, do you believe that Medicaid is a critical program?
I believe that Medicaid is a critical program, but that it's not working as well as it ought to be. And President Trump has asked me to make it work better, that most Americans are not happy with it, that the premiums are too high, the deductibles are too high, and everybody's getting sicker. Too much money is going to the insurance industry.
I have a series of yes or no questions. They're pretty simple. Because you heard we're not going to get a second round of questions, I ask for your indulgence to be able to get through them yes or no. In New Mexico, as you know, Medicaid is often measured state by state. It might surprise you if you look at some of those surveys. In New Mexico, the response was 90% of New Mexicans on Medicaid report satisfaction getting care, 80% getting specialist care, 85% getting urgent care, 95% ease of filings out of focus. Not to pick on any one of my colleagues, but in Louisiana, 86% of people on Medicaid are satisfied with their interactions. 83% are satisfied getting care. 85% are satisfied getting specialized care. 82% getting urgent care. I can go on state by state, but we don't have the time today. Yes or no, do you support cutting Medicaid or reducing, and especially in an area where you and I spoke about with the federal investment in Medicaid, which is known as FMAP?
President Trump has not told me that he wants to cut Medicaid. He's told me to make it better.
Do you support cutting, yes or no? Let me ask you this way, since it's only about President Trump.
I support making it better, Senator.
If President Trump asks you to cut Medicaid, will you do it?
Well, it's not up to me to cut Medicaid. It would be up to Congress. And I'm going to work.
Mr. Kennedy, you don't want to answer? I'll move on. Do you know how many states will end Mr. Chairman, if I may pause my time. So I understand that people are getting asked to leave if they stand up with signs, but there's a lot of other as well, Mr. Chairman. So it needs to be extended to everyone. As Mr. Kennedy said, we should respect each other when we have a difference of opinion. We're just trying to do our jobs here and trying to ask questions. That's all. And that's all I'm doing with Mr. Kennedy, folks. So I just hope that we can
Senator
do that.
Lujan, you are right, and I ask the audience to please be respectful.
Thank you, Mr. Chairman. I appreciate that very much. Mr. Kennedy, do you know how many states will end their Medicaid expansion if the federal share of Medicaid drops?
Well, there's 40 states that have signed on to the expansion. So,
It's a smaller number. So it's 9 states would quickly have to end their expansion because of the laws that they have. That's about 4 million folks across the country. And in New Mexico, Iowa, and Idaho, they have triggers that it would immediately have to go into effect if, in fact, that gets cut. The reason I'm asking those questions is there's been a lot of chatter and conversations around Medicaid. Now, I agree we can always do better, and we must be doing better in America. But Medicaid has been shown to improve health outcomes, including mortality, quality of life, and access to preventative care as well. And there's some areas, Mr. Kennedy, that you and I touched on specific to Native American communities. One of the concerns that I have are these programs matter to folks. You shared your passion about caring for folks. I believed that passion. My question in this area is, as you know, when folks are doing research and they're going to check to see if medicine works on someone, if they're not included in that trial, it often doesn't help them. That's what all the evidence shows. So what are you going to do when programs are eliminated to require the inclusion of Native Americans in clinical trials when it comes to life-saving medicine?
I'm going to do everything I can to make sure that there's Native Americans in clinical trials. As I said to you when I visited your office, I spent 20% of my career working on Native issues. My family's been deeply involved with them. My father and uncle were big critics of the Indian Health Service, the failure to deliver good health results or health care on the reservations. I'm going to bring a Native in for the first time in history into my central office, that all the major decisions in my office will be that he will have it. We've already interviewed a candidate, a very, very good candidate, will have direct impact on all the major offices. One of my priorities is to improve.
I appreciate that. I have a follow-up in that space specifically. Will you commit to finalizing the congressionally mandated FDA guidance to increase clinical trial diversity?
Just repeat that again. I'm sorry,
Will
Senator.
you commit to finalizing the congressionally mandated FDA guidance to increasing clinical trial diversity?
Yes.
I appreciate that. Will you commit to reinstating all of the pages that were eliminated and people that were fired from this administration that have this responsibility?
I cannot commit to that because I don't know who they are.
Well, there's
I'll
some
commit
folks
to
out there doing the
working
work.
with you to make sure those positions are adequately staffed.
I will follow up in writing in those specific areas because I think there's some commonality here, but answers matter. And so I'd like to get those as timely as possible. The last thing, Mr. Chairman, that I'll say is one of the conversations I had last before this hearing was with a family that I've been working with to work with my Republican colleagues when it comes to autism and federal programs and making a difference in these families' lives and this little girl's life. What I'm asking now, Mr. Chairman, is unanimous consent to enter into the record an article from Autism Speaks titled, quote, "Do Vaccines Cause Autism?" End quote. And I'll note that the first sentence states, quote, "Vaccines do not cause autism," end quote. Thank you. I yield back.
Without objection. And before we move on, we've had a request from several quarters for a quick restroom break. We will take a 5-minute recess. I'm sorry to those remaining 5 or 6 senators who must wait a few minutes, but we will have a quick break. We will be back as soon as we can.
Would everyone please take your seats? This committee will continue and come out of recess and go back into session. Before we go to you, Senator Marshall, I'd like to just tell everybody the remaining list: Senator Marshall, Senator Warnock, Senator Smith, Senator Young, and Senator Welch. And then I did indicate earlier that I would give another 5 minutes to Senator Wyden. I understand he has distributed that 5 minutes to a few of the other senators. So we will have a few more quick questions, and then we will proceed. And I would like to thank the audience again. I know we had a couple of outbursts earlier, but I want to thank the audience for being respectful and encourage the audience to continue to be respectful as we conclude the hearing. With that, Senator Marshall.
Thank you, Chairman. Obesity, diabetes, heart disease. Obesity, diabetes, heart disease account for probably 80% of health challenges in America. You know how many times I heard my friends across the aisle mention any three of those? I don't know if we've lost the forest for the trees here. Vaccine is a critical issue. I understand that. I don't see how Mr. Kennedy's position could be any more clear that he's going to support the vaccines, he's going to support the science and empowerment to parents and their doctors to make these choices. 60% of Americans have a chronic disease, that there's an epidemic of chronic diseases across the country. And this Make America Healthy Again movement is palpable to me. It started on the campaign trail in 2020 when moms I'd never met, that never involved in the political process, came up to me and said, look, I want to make these choices about my children with my doctor, not the federal government. That it's a very real thing. Moms, dads, grandparents across the country grab me and say, look, why do 20% of our children now, why are they on a prescription drug? So, Mr. Kennedy, what is your prescription to help make America healthy again? What's your vision? What does that look like to you?
Thank you, Senator Marshall. We're having epidemics of all these chronic illnesses, autoimmune diseases, neurological diseases, allergic diseases, obesity. When my uncle was president, 3% of Americans were obese. Today, 74% of Americans are obese or overweight. No other country has anything like this. In Japan, the obesity rate is still 3%. And epidemics are not caused by genes. Genes may provide the vulnerability, but you need an environmental toxin. Something is poisoning the American people. And we know that the primary culprits are changing food supply, the switch to highly chemical intensive processed foods. We have 10,000 ingredients in our country, in our foods. The Europeans have only 400. If you buy McDonald's French fries in our country, there's 11 ingredients, my understanding. In Europe, there's only 3. If you buy Fruit Loops in our country, they're loaded with food dyes, with yellow dye, red dye, blue dye, and many other ingredients. The same company makes the same product with different ingredients for Canada and Europe. And at age, we don't have good science on all these things. And that is deliberate. That's a deliberate choice not to study the things that are truly making us sick, that are not only contributing to chronic disease, but to mortalities from infectious disease. We need to get a handle on this, because if we don't, it's an existential threat. Our country is not going to be destroyed because we get the marginal tax rate wrong, or because we get one of these culture war issues that we've been talking about today wrong. It's going to be destroyed if we continue down this trajectory of chronic disease. We need to fix our food supply, and that's the number one.
Thank you, Mr. Kennedy. Certainly, I share your concern with ultra-processed foods. On the other end of this food chain are my farmers and ranchers back home. Would you just take a second and share your compassion, how you feel about farmers and ranchers, that they respond to the market. They don't dictate the market. They grow what the market is wanting them to grow.
And Senator Hawley told me the other day that his brother-in-laws are all farmers. And he said 4 out of every 5 of his brother-in-laws has Parkinson's disease. And that kind of cluster we're seeing across farm country of cancers, autoimmune diseases, obesity, et cetera. Oh, it's, and we can now not export American food to Europe because the Europeans won't take our food. That's not good for farmers. We're also destroying our soil because some of the chemicals that farmers use destroy the microbiome, and that causes the erosion of the soil. You can't get water infiltration. Water pools up and it washes the soil off. Agronomists now estimate that we only have, if we continue doing these processes, only 60 harvests left before our soil is gone. Farmers are using seeds and chemicals that are, over the long term, are costing them and us. And what we need to do is we need to support the farmers. We need the farmers as partners if we're going to make them work. And I don't want a single farmer to go out of business under our watch. I don't regulate farms. If I'm privileged to be confirmed, I'm not regulating farms. That's under USDA. But I want to partner with all of my decisions with USDA and with the farm community to make sure that we don't lose more farmers in this country, but that we also transition. We offer and incentivize transitions to regenerative agriculture, to no-till agriculture, and to less chemically intensive. And by the way, I've also met with the chemical industry and the fertilizer and herbicide companies, and they want to do the same thing. Oh, and I think we're on the trajectory to do that, and we need to incentivize initiatives to accelerate that trajectory.
Mr. Chairman, if I could, the great news is that my farmers in Kansas are selling products to Europe, that today's regenerative practices, soil health, all those things are priorities for Kansas farmers. Many of us are doing many of those things already. We just need it to be more widespread. If I could just wrap up my remarks, though, is that, again, going back to the big picture here, 60% of Americans have a chronic disease. Mr. Kennedy, I believe for such a time as this that you're not just one of 300 million people. I think that you are the person to lead HHS to make America healthy again, that God has a divine purpose for you, and I look forward to your confirmation and working with you to make America healthy again.
Thank you, Senator.
Thank you. Senator Warnock.
Thank you so much, Chairman Crapo and Ranking Member Wyden. It's great to be here. Mr. Kennedy, welcome. Welcome to you and to your family. Thank you for meeting with me a few days ago. I'd like to follow up, if I might, with some of the issues that we discussed in my office. I want to talk to you first about the CDC, or the Centers for Disease Control and Prevention. I'm proud of the work that the CDC does, proud that it's located in Georgia with more than 10,000 employees in my state. If confirmed, you would be the cabinet secretary over the CDC, representing HHS. It's about 29% of the federal budget. CDC is a part of that. Do you agree that the CDC's work is critical to Georgia, critical for our country, and the health of the entire world?
Yes, Senator.
Senator Isaacson, my Republican predecessor, would have agreed with that. Bless his memory. He was a fierce advocate for the CDC, as am I. The CDC is an agency filled with hard-working, dedicated public health servants. They wake up every single day working to keep us safe. I think we don't think often enough about their work because it's easy not to celebrate the folks who are protecting you from that which doesn't appear because of the work that they're doing. So grateful for the work that the CDC employees do. Some of them are members of my church. I saw that deep commitment firsthand when I visited the CDC just last summer. Mr. Kennedy, you have compared the CDC's work to Nazi death camps. You've compared it to sexual abusers in the Catholic Church. You've also said that many of them belong, this is a direct quote, many of them belong in jail. For me, those are disturbing characterizations of the CDC workers that I know who are trying to keep the American public safe every single day. And as you are presented as the nominee for this position, I need to know, do you stand by those statements that you made in the past, or do you retract those previous statements?
Senator, I don't believe that I ever compared the CDC to Nazi death camps. I support the CDC. My job is not to dismantle or harm the CDC. My job is to empower the scientists if I'm privileged to be confirmed.
So you retract those statements?
I'm not retracting it. I never said it.
Well, actually, I have a transcript
of me saying that it's a Nazi death camp.
Yeah, let me read your words. It says that the institution CDC and the vaccine program, is your description of their work, is more important than the children that it's supposed to protect. And you know, it's the same reason we had a pedophile scandal in the Catholic Church. It's because people were able to convince themselves that the institution of the church was more important than these little boys and girls who were being raped. That's pretty provocative language. You said in another statement to me, this is like Nazi death camp. I mean, let me finish. I'm just reading your words. I mean, what happened to these kids? 1 in 31 boys in this country, their minds are being robbed from them.
Yeah, I was not comparing the CDC to Nazi death camps. I was comparing the injury rate to our children to other atrocities. And I wouldn't compare, of course, the CDC to Nazi death camps to the extent that any statement that I made has been interpreted that way. Yeah, I don't agree with that. In 2003, the United States Congress Government Oversight Committee ended an over a year investigation of the CDC and used almost that same language. They said that the CDC, just one division, one branch, the Immunization Safety Office, had put institutional self-interest and pharmaceutical profits ahead of the welfare and health of American children. So that was a conclusion by Congress. And I repeated that.
I'm asking you because you're the nominee for HHS. It sounds like you stand by those statements.
Senator, my objective is to support the CDC. There's nothing I'm going to do that is going to harm CDC. I want to make sure that our science is gold standard science, and it's free from that same Government Oversight Investigation Committee. That the panels, the ACIP panel within CDC, I think 97% of the people on it had conflicts. I don't believe that that's right. I think we need to end those conflicts and make sure that scientists are doing unobstructed science.
So I want to enter this statement, by the way, into the record without objection.
Without objection.
Last week, the White House gagged HHS and the CDC, preventing them from communicating all important public health information to anyone, including all of our allies, including our allies in the United States and global disease prevention. Can you just answer yes or no, because I'm running out of time? Do you agree with that action?
I was not consulted on it, but that's pretty much standard operating procedure for incoming administration.
So you agree with the action that gagged HHS and CDC from communicating important public health information?
That directive made sure that no public health, that only non-essential travel and mass communications were temporarily suspended pending the confirmation of a new HHS secretary. This is standard operating procedure for every administration.
I get it. I don't think what we've seen over the last several days is standard operation for new administration. I think we're seeing some unprecedented actions, but you agree with it. Last night, members of the CDC, along with other federal employees, were actually invited to resign, these buyouts. And I got text messages and folks I know work from the CDC, for the CDC, that do this important work, who got that note. And it's really important because my experience is that when you send out that kind of note, the folks who resign are the folks who you least likely want to see resign. They got other options. They're gifted folks. They got a lot of expertise. They have options. A lot of them are doing this work because of their patriotism, because of their commitment. Do you agree with the buyouts that were presented to CDC employees just last night?
I agree. At the vast majority of the scientists and experts at CDC are patriots and good government servants.
Can you tell me yes or no?
I don't think anybody's going to resign who's committed to making America healthy again.
Can you just answer yes? Okay, you agree with the buyouts. In our meeting, I asked you to confirm your support for the Affordable Care Act. You also mentioned that you and President Trump want to fix the ACA by making premiums more affordable. Can you answer me yes or no, as I don't have a lot of time? Did you know that tax credits that help families afford health insurance and save Georgians an average of $531 per month per person are set to expire at the end of the year? Did you know that?
I do.
We need to move on.
Do you support Congress extending these tax credits so that Americans can continue to afford health care?
Congress has to make its own decisions about that. My instructions from President Trump
you're saying I'm running out of time, but I'm having a lot of trouble getting the witness to answer yes or no to a yes or no question. Well, and I've got one more question.
You're almost at 9 minutes, sir.
Well, I need him to answer yes or no. Yes or no?
I'm not going to answer yes or no to a question that's not susceptible to an honest yes or no answer.
Okay,
we need to move on.
I think that the fact that you find it difficult to answer basic questions is deeply troubling for me as you present yourself as a nominee to run HHS. Thank you so very much.
Senator Smith.
I've been in courts all over the country and prosecutors.
Mr. Chairman, you told me I'm out of time, and the witness continues to filibuster even after I said I'm done.
Senator Smith.
Mr. Chair, thank you. Thank you, Mr. Chair and Ranking Member, and welcome, Mr. Kennedy. So, Mr. Kennedy, I don't have a question for you on abortion. I think that my colleagues on both sides of the aisle have covered this, but I want to say I can respect people who have different views than mine on this issue, but it's hard for me to respect people who won't give a straight answer to what they think on this issue in particular. Mr. Chair, I just want to note that I understand that anti-choice advocates have said that in these hearings they were looking to hear Mr. Kennedy provide some reassurance that he is on their side, and I'm not hearing that. And I think most Americans are looking for some hint that the decisions that people make about abortion should be personal and private, and they should be free to make those decisions without government interference, and I'm not hearing that either. To make it worse, the answers that you have given tell me that the Trump administration is more than willing to restrict or even ban medication abortion without a single act of Congress, and even in states where abortion is legal. And what is clear to me is that you and President Trump are dangerous to women's access to mifepristone. So having said that, I want to move to a different topic. Mr. Kennedy, I appreciate Senator Cornyn's questions about mental and behavioral health, something that I care a lot about. I know that you and your family have had personal experience with mental health challenges, as have I. And I agree that the mental health crisis in this country is a crisis. So let me ask you, in an interview in 2023 and again in 2024, you blamed school shootings on antidepressants. You said, and this is a quote, "There is no time in American history or human history that kids were going to shoot schools and shooting their classmates. It really started happening coterminous with the introduction of these drugs, with Prozac and with other drugs. So do you believe, as you've said, that antidepressants cause school shootings? This should be a simple question.
I don't think anybody can answer that question, and I didn't answer that question. I said it should be studied.
So your answer is?
I said it should be studied along with other potential culprits, like
So they may cause
social media. But I don't know. I would never make, because there's no science on that,
Well,
Senator.
there is, Senator. I mean, excuse me, there is, Mr. Kennedy.
Thank you for the promotion.
The science shows that there is no link between school shootings and antidepressants. And in fact, most school shooters were not even treated with antidepressants. And of those that were, there was no evidence of association. You know,
I don't think you can say that, Senator, because of HIPAA rules, nobody knows.
Well, that is, Mr. Kennedy, do you think that people who take antidepressants are dangerous?
I think, listen, I'm not going into HHS if I'm privileged to be confirmed with any.
So you can't say that people
to impose any preconceived ideas that I may have. I just want to have good science.
So you're not saying that they aren't dangerous, which means that they could be dangerous. Let me ask you this.
That's not true.
You've described Americans who take mental health medications as addicts who need to be sent to wellness farms to recover. Is that what you believe?
No, of course I didn't say that anybody should be compelled to do anything.
No, but you said they should be sent.
I said they should be available to them. I didn't say they should be sent.
You said that folks that take antidepressants are like addicts. That I can provide that,
Oh, I think they should have the availability. Listen, I know people, including members of my family, who've had a much worse time getting off of SSRIs than they did than people have getting off of heroin. It's the withdrawal period is, I mean, and it's written on the label.
I have some experience with this myself, Mr. Kennedy. This is personal for me. When I was a young woman and I was struggling with depression, thankfully, I had the resources to help me get through it, including a new generation of SSRI uptake inhibitors, which helped to clear my mind, get me back on track to being a mom and a wife and a productive, happy person. And I'm really grateful for that therapy. So I have some experience with this, and I think that everyone should have access to that care. And your job as secretary is to expand access to care, not to spread lies and misinformation. And you know, the things that you say, Mr. Kennedy, they live on. They have impact. And, you know, we're having this conversation at the same moment that my Republican colleagues are looking to try to figure out how to save money any way they can. And so they want to cut Medicaid. Let's just think about this for a minute, because you're going to be, should you be confirmed, you would be responsible for CMS, which provides mental and behavioral health care to millions of Americans. Close to 40% of folks on Medicaid have a behavioral health condition. And you would be part of this administration that would be looking to cut Medicaid. So, Mr. Kennedy, these statements that you've made linking antidepressants to school shootings, they reinforce the stigma that people who experience mental health every day face every single day. And I'm very concerned that this is another example of your record of sharing false and misleading information that actually really hurts people.
Senator, you're mischaracterizing my statements.
I am only putting into the record what you have said, Mr. Kennedy.
You're mischaracterizing my statements, and I'm happy that you had a good experience on SSRIs. Many Americans have very good experience on it. Others have not.
That would be an issue between them and their physicians, and not for the future head of HHS to be putting out misinformation about the dangers of SSRIs and other antidepressant medication, spreading the stigma and the fear that we're actually trying to overcome.
Do you think physicians, when they make that prescription, ought to have access to good science?
Of course they do. And
that's all I believe, too. And you and I are in agreement, Senator.
And to your point that you made when you made these statements, it was not based on good science. I don't know what it was based on.
I was saying the science needed to be done. I was saying these are potential culprits. We're coterminous, and I named other things. I said video games. I said social media. I said SSRIs. SSRIs have a black box warning of suicidal, homicidal behavior.
Mr. Chair, I will submit to the chair the information that I have about what Mr. Kennedy has said linking antidepressants to school shootings. Thank you.
Senator Young.
Thank you, Mr. Chairman. Good to see you, Mr. Kennedy. to follow up on that spirited exchange, in talking with you and reading about your vision for the department, you said one of your goals is to return public health agencies to the gold standard of scientific review. You've alluded to the gold standard a number of times today. So I'm going to give you an opportunity, uninterrupted, but hopefully not too extensive, to tell me and others what you mean by this gold standard.
The gold standard means real scientific research with replication of studies, which very rarely happens now at NIH. We should be giving at least 20% of the NIH budgets to replication. We should make sure that all the science is published with the raw data. We should make sure that the peer reviews are also published. And I'll give you a quick example. 20 years ago, NIH scientists did a study on Alzheimer's, which they said it was caused by amyloid plaque. After that, NIH shut down studies of any other hypothesis. 20 years later, we now know that those studies were fraudulent. NIH has funded 800 studies on a fraudulent hypothesis, and we've lost 20 years in figuring out a cure for Alzheimer's. And that's just one example. I could give you hundreds. We need to end that. We need to end the old boy system. We need to have replicatable science and be completely transparent about raw data.
Thank you, sir. In recent years, particularly during the COVID pandemic, there's been a lot of skepticism about our public health institutions. Some of this, I would say, is warranted, but it's now created a pervasive lack of trust from the public that these institutions are acting in bad faith or failing to act in objective criteria, failing, in short, to act in the best interests of the public. If confirmed, Mr. Kennedy, how will you work to regain the public's trust? I suspect it will take some time in these important public health institutions.
Through radical transparency, I'm going to make the reason people don't trust the public health agencies is because they haven't been trustworthy. And you gave the example of COVID. At the beginning of COVID, everybody was rushing to get that vaccine. We had over a 90% vaccination uptake.
Yes, sir.
CDC's most recent recommendation is that Americans take the 8th booster. Only 23% of Americans are complying. That means 77% of Americans no longer trust CDC, and that is the problem.
Yes, sir. In the absence of full information, might it, I think agree with you, but I want your response. Might it make sense to share that absence of full information with the American people, that uncertainty? I think one of the things by observation and experience that I saw during the pandemic was we had certain prominent doctors appear on television and indicate, no, you absolutely must not wear a mask. 2 weeks later, it's yes, you must wear a mask. But they were certain. And they even demonized people for not following the latest science, knowing there's a high level of uncertainty in that science. Would a measure of humility and, as you say, radical transparency demonstrates humility, help rebuild trust over a period of years?
Absolutely. We need to tell Americans what we don't know. We need to make sure studies that reach a null hypothesis are also published. And that doesn't happen.
Sir, I think you are right about why healthcare costs are so high in the first place. The answer is indeed chronic disease. 90% of our healthcare spending goes towards managing it, as you say in your open statement. It's not in the main because of waste, fraud, and abuse, although we know some exist. It's not in the main because we have greedy executives at innovative world-class companies. It's not in the main because we haven't yet adopted an unsustainable Medicare for all scheme. It's because of this. So I'm encouraged that you intend to make that a point of emphasis as it pertains to your future leadership. I will say, with respect to COVID, it's not over for a lot of Americans. It's not over. I know the mission accomplished banner was convenient for the last administration, but as we continue to navigate the ongoing impacts of the COVID pandemic, we have many individuals here in the United States and around the world who are suffering from long-term health effects that significantly impact their quality of life, work, and daily activities, and they've been largely ignored. Funding for long COVID research was appropriated by Congress in December of 2020, followed by additional funding directed by the Biden administration in February 2024. Patient groups and industry publications have criticized the slow pace of clinical trial design and enrollment. If confirmed, will you collaborate with healthcare providers, researchers, and effective communities to better understand and mitigate long COVID's impact? Yes or no, please?
Absolutely, Senator. There's 16 million Americans.
Will you commit to prioritizing long COVID research and integrate this work into broader healthcare policies? Yes or no, please?
Yes.
Patient groups, experts, and industry publications have raised concerns around existing long COVID funding being spent on observational research. In particular, criticism was directed towards recover funding being used to duplicate existing findings instead of funding trials for potential treatments or diagnostics. If confirmed, Mr. Kennedy, will you work with Congress so that going forward, long COVID funding will be directed primarily towards trial or novel research directions and not replicating existing observational research? Yes or no?
Absolutely, Senator, with enthusiasm.
Thank you so much. If confirmed, how will you create a balance between your personal priorities of chronic disease and healthy lifestyle and the ongoing critical work of the department in areas that are focused on incentivizing and advancing innovation in modern medicine and pharmaceutical discovery?
I think innovation is going to be the key to public health. And we have a unique opportunity now in history because of AI, because of telemedicine, and because of the quality of people that are now coming to HHS to actually save public health. But it's all going to rely on innovation, and I don't want to do anything that inhibits or impairs the pace of innovation.
That's encouraging. From approving AI algorithms to determining Medicare coverage, we certainly need more innovation, and we need good people in the department to assist with that effort. So I'll follow up with a question about how you're going to attract and retain good people. Thank you, Chairman.
Sorry to shut you down a little faster than I did the others, Senator. We are up against a vote deadline here, and we have one more senator who gets his full time. I hope you'll keep it as close to 5 minutes as you can, Senator Welch. And then I've promised Senator Wyden, 5 more minutes?
To be divided 1 minute with my colleagues getting 1 minute.
And then if we can do that, we can get over to vote before they call the vote on the floor.
Thank you very much. Thank you, Mr. Kennedy. And as you know, I'm have great reverence for your family. From Massachusetts. When I got out of college, I was in the first class of Robert Kennedy Fellows, the memorial created by your family to honor the service of your father. I do community organizing in the west side of Chicago. And I certainly admire your energy in your effort here and desire to serve. You know, there's a couple of things that are really important here. This is not just about a debate on vaccines. It's a debate about the qualifications, experience, and priorities as to the person that will head Health and Human Services. And it's not just about what your answers are today or what the questions are. It obviously has a lot to do with your whole record and your whole history. You know, your sister in her letter, or pardon me, your cousin in her letter said, you've always been charismatic, able to attract others through the strength of your personality, willingness to take risk and break rules. That's, I guess, an attribute, but it can be a danger. The question I fundamentally have is whether your willingness to disrupt and maybe break rules is going to be dangerous and destructive. The character questions we didn't go into here, but there's some sketchy things you've acknowledged. Your history with heroin, you've gotten over that. But there's incidents that do, I think, concern the question of whether the stability is there to be in charge of this major organization. And that's compounded by my concern that you don't have any experience managing a large organization, that you don't have any experience in government. So those are things that have to be taken into account. But the issue for me is also priorities. A lot of your engagement in health has been on vaccines, big important issue. You actually disagreed, as I understand it, with President Trump about Operation Warp Speed. I think President Trump deserves a lot of credit for Operation Warp Speed. He knew we had to get a vaccine. And these other issues about a mask and whether you should wear it, whether when you got your groceries, the bag had to be left outside, remember that in the very beginning? Those are incidental to the core question that the president believed we had to have a vaccine. And you contested that. That worries me. That really deeply worries me. The other questions, Senator Cassidy asked you some questions about our healthcare system. I happen to believe that our healthcare system is profoundly broken. And it's not just about the chronic illnesses. That's about our diet. That's about our exercise. But we are getting premium increases in Vermont of 20% a year, 25% a year. And it's busting the bank for taxpayers. It's busting the bank for our wonderful Vermont employers who care about having health insurance that they can provide to their employees. Senator Cassidy asked you a couple of questions about how you would reform Medicaid, and I didn't hear an answer. You mentioned that you thought Medicare Advantage was good. You have a good plan. No focus on what an incredible ripoff was reported in the Wall Street Journal by United Healthcare, which was marketing Medicare Advantage and then paying doctors and nurses where they had assignments essentially to diagnose illnesses that didn't exist. So they made billions and billions of dollars. And I've seen nothing coming out of the Trump administration, and I've seen nothing coming out of your advocacy that is going after what is a rampant abuse by the insurance companies and overcharging people and not doing the job. And by the way, the United Healthcare people, when they did that, they overdiagnosed. When the person really got sick, they dumped them. They dumped them. Go to the nursing home on your own. That's a broken healthcare system. We spend the most and get the least. And I think there should be collective anger about this on both sides because all of our people are dependent on that healthcare system. And you're going to be working for a president who's on a lawless rampage right now, okay? He has done something reckless with the pardons to these cop beaters. I'm appalled by that. But that's just reckless. That's not illegal. He's impounded money. So right now, the Medicaid website went down. He's impounded money. So the community health centers that Senator Warner was talking about are up in the air as to what they can do. Do you believe that a president can impound money that has been appropriated by Congress?
Senator, let me answer the question about Medicare first. I have never defended that program or the rapacious behavior by insurance companies or the PBMs. I understand that's a huge problem. And
all right, I don't have time. We've got to get over to vote. So we can do this.
But you've asked me 5 questions. You got to give me a chance to answer one of them.
Please be brief.
Yeah, I brought in, if I get confirmed, I've already appointed a general counsel. The first time in history, he's a former prosecutor who prosecuted the biggest Medicare fraud in the case in the state of West Virginia. I brought in a prosecutor for that job instead of a bureaucrat, precisely to address the important issues that you raised here. The only reason I didn't talk about these before is because I wasn't asked about them.
What about,
I agree with you 100%.
Right, what about impounding, a president impounding money that, among other things, goes to health care?
And you're saying that that's illegal?
That's correct.
Well, my job is to uphold the Constitution. I'm going to take an oath to uphold the Constitution, and I will administer the law and uphold the Constitution.
Mr. Chairman, I believe under what we've discussed, I control 5 minutes. I'm going to take one and give one to each of my 4 colleagues that remain.
All right, and I would just say this vote, they're going to call it in about 8 minutes.
Thank you.
So we have very little time.
2 hours ago, colleagues, I asked Mr. Kennedy to reconcile his many anti-vaccine statements with his handful of pro-vaccine statements. Instead, he gave us a word salad and ducked the issue. The same was true, Mr. Kennedy, with respect to measles, where you wrote a book playing down the threat of measles, even though American families are very concerned about it, and apparently families are still mourning in Samoa. And my last point would be that Mr. Kennedy said today really wasn't about him. And I just want to tell him it is all about you, because I find your presentation to be both untrustworthy and unprepared, because my colleagues have been seeing back and forth between Medicare and Medicaid, and it's not clear which program you're using when. So I want colleagues to know there is a lot more information to learn about Mr. Kennedy before we vote. I'm going to urge that to my colleagues on both sides of the aisle to not make decisions on the basis of this session. I thank you for the additional time. And I guess my next minute is Senator Whitehouse, Senator Warren, and Senator Smith.
And again, 1 minute each, please.
There's been a lot of conversation about late-term abortions here, and I just want to make clear what Rhode Island OBGYN doctors describe as what is almost always happening when a late-term abortion is needed. It is a childbirth gone wrong. The family has painted the room, it has bought the crib, maybe even decided on the baby's name, and has gone to the hospital to welcome the new baby into their family in what is supposed to be a happy event. And then things went wrong. Then the alarms started pinging. The lights started flashing. The medical professionals started rushing in. And the question became, who lives and who dies? The mom's life is often at risk, and she may have other children she needs to care for. The baby's life may be at risk, and one or both may die. In that environment, the doctors and the family own that decision. Government has no place in that room at that point. And I think we need to understand when this late-term abortion gets bandied about, what you're dealing with is a tragedy that is happening to a family who wanted that child and have suddenly been confronted with a moment in which they have to make what is probably going to be the worst decision of their lives. And to try to shove the state legislature into that room is really offensive, really morally wrong, and I just want to make very clear what Rhode Island OBGYNs tell me is the situation when these procedures have to be deployed.
Senator Warren.
Thank you, Mr. Chairman. So, Mr. Kennedy, I wanted to ask about your role in the 2019 measles outbreak in Samoa. In July 2018, 2 children died immediately after receiving a measles vaccine that nurses had mistakenly mixed with a muscle relaxant. The nurses get charged with manslaughter, but vaccination rates go down. I asked you about this in my office. You told me flatly that your visit to Samoa had nothing to do with vaccinations. We now know that's not true. I have the documentation. You met with the Prime Minister. You talked about vaccinations. You met with an anti-vaccine influencer who described the meeting as, quote, profoundly monumental for this movement. So what happens? Vaccinations go down, there's a measles outbreak, and children start dying. But you double down. You didn't give up. Just 4 days after the Prime Minister declared a state of emergency, 16 people already dead, you sent a letter to him promoting the idea that the children had died not from measles, but from, quote, defective vaccine. You launched the idea that a measles vaccine caused these deaths. You are a very influential man. In fact, you are called the leader of the disinformation dozen. UNICEF and WHO, the World Health Organization, investigated this. They say the claims are false. It is not biologically possible what you claimed. And yet, ultimately, more than 70 people died because they didn't get vaccines. So my question is, do you accept even a scintilla, just even a sliver of responsibility for the drop in vaccinations and the subsequent deaths of more than 70 people? Anything you do differently?
No, absolutely not. There were 2 incidents which children died in 2015 and again in 2008. 2015, it was from the measles vaccine. That's what the New Zealand General Hospital found. The government of Samoa banned the measles vaccine after the 2018. I arrived in July of the next year after the ban had been in place for a year.
Mr.
And
Chairman,
the measles,
understanding that you wanted to hold this to a minute and that I don't get to present all the facts and documentation I've got, how about if we just decide to make entries for the record on exactly what the record shows about Mr. Kennedy's participation? And I think he's answered the yes or no question. He takes no responsibility.
Senator Warren, we will do that. And Mr. Kennedy, and to all the senators, every senator knows that following this hearing, they will be able to ask you questions off the record, and you will be able to put answers back onto the record. So please give that answer. I apologize that we're shutting you off for giving a full response right now. Senator Smith, and we are way over time.
Thank you, Mr. Chair. So, Mr. Kennedy, you have said that you want to give infectious diseases a break for about 8 years. You spoke about this with Senator Cantwell. My question to you has to do with avian flu. Over 100 million birds culled. The disease has spread to dairy cows, and there are now 67 confirmed human cases and 1 death. So, Mr. Kennedy, do you intend to give research on bird flu a break?
no, I intend to devote the appropriate resources to preventing pandemics. That's an essential part of my job.
What do you think is causing the avian influenza?
I think the H5N1 virus is.
So that's good to hear, because in a recent book, I will submit this for the record because we don't have that much time, Mr. Kennedy has questioned the scientific basis for germs causing disease and the power of vaccines and antibiotics.
I've never questioned that, Senator.
Well, I will submit that for the record.
Thank you. Senator Warnock, 1 minute.
I like the way you said that to the Baptist preacher. Thank you so much, Mr. Kennedy. Based on our conversations, it's my understanding that you support work requirements in Medicaid. In 2020, President Trump approved a proposal from Georgia state leaders requiring Georgians to jump through a number of onerous bureaucratic hoops and fill out even more paperwork to verify work and get access to health care. I ask this as someone who represents a state that has not expanded Medicaid. The federal government, because of this waiver, spent $70 million on Georgia's Medicaid waiver. 82% of that went to administrative costs. The point that I'm making is that the folks that they're insisting need to work, 90% of those folks are working, they are caregivers, or they have a disability. Let me give you one example. A woman I think of all the time, her name is Heather. She's a traveling nurse from Dalton, Georgia, who falls into the Medicaid coverage gap. Heather experienced a series of small strokes, leaving her unable to work full-time. She's dedicated her life to caring for patients, but now she can't afford her own medical care, out-of-pocket costs, because she doesn't make enough to qualify for tax credits to buy private insurance. What does Heather need? Does she need work requirements, or does she need access to health care so she can finally get healthy and get back to work?
The individual that you described would need health care and not a work requirement.
Thank you.
Thank you.
Thank you.
Thank you. And we are done with the questioning now, Mr. Kennedy. I apologize to you, to the audience, and to all of my colleagues to have to rush it here at the end, but we have a vote on the Senate floor that they're going to close in about 3 minutes. I want to thank you for appearing before this committee. You have been accessible to the members and staff on both sides of the aisle of the Finance Committee throughout a rigorous process, and I want the whole world to know that you spent hours in meetings answering questions outside of this hearing and providing documents and responses on issue after issue after issue. You've gone through the most thorough vetting process that any committee in this Congress puts anybody through. And I think that you have come through well and deserve to be confirmed. I would like to remind my colleagues that the deadline for submitting any questions for the record is 5 p.m. today, 5 p.m. today. And Mr. Kennedy, we ask that you respond to those questions as quickly as you possibly can. With that, I'm going to leave you in this room and run over to vote. This hearing will be adjourned. I still encourage the audience to be polite and respectful no matter what side of the issues you may be on. And Mr. Kennedy, I look forward to working with you.
Thank you, Mr. Chairman.
We're adjourned.
Let's go. Nur jetzt bei Saturn und Mediamarkt. Das Apple iPhone 14 mit 128 GB und 6,1 Zoll Display für 639 €. Schwarz, weiß, blau, wir haben sie alle beim WSV-Finale. Nur jetzt mit 12% Rabatt auf die UVP. Saturn und Mediamarkt.